Kowalski's with assistance from Greg Anderson, Nick Whitney, and Jennifer Anderson.
Ms. Lawrence, good morning.
Howard Hunter, Your Honor, with Pat Crowell's, Ethan Shapiro, and David Hughes, and Chris Altenburn for Johns Hopkins All Children's Hospital. Our corporate representative today is Dr. Michelle Smith.
Morning. I'm trying to see if Mr. Altenburn is here. Mr. Hughes is blocking him.
I'm here. I'm sorry, Your Honor, but preliminary matter, we have, I don't want to ignore the doctor in the room. Dr. Kirkpatrick is here. We have him under subpoena. We left a message with his office on Friday, which he acknowledged he got, that said he did not need to appear this morning. And he's here in the courtroom. And we've advised him we don't need him today. We told him on Friday not to come. But he's here. He's not released from his subpoena, so he can't stay in the courtroom. Not sure why he's here, sir, but I wanted to address the issue.
Is he, I'm trying to figure out where he is in the treating expert panoply of experts.
I think the ruling from the court's been clear that if you're a treater, you don't get to, that the thing's been, that the rule's been invoked. If you're an expert, retained expert, it's not.
I thought the court had made a ruling as to Dr. Kirkpatrick in particular that he was going to be deemed an expert as opposed to a treating physician. But if I'm wrong, I'll tell him.
Well, I think Dr. Kirkpatrick, as a treating physician, needs to be outside. If he were to be here all day for not being called as a witness, I mean, I don't know what's going on there.
We are not calling him as a witness today. We told him that on Friday, his office. We are not releasing him from his subpoena. Depending on where the trial goes and what evidence is in, we may or may not call him.
It's fine, Pat. Doctor, you're going to have to step out. Yeah.
I want to begin today, or I guess our next issue today, since we already had a first issue, is to pick up where we were discussing at the end of the day on Friday, which I thought was a very illuminating discussion, but certainly Mr. Anderson and Mr. Hunter weren't in the room. I'm hoping each side has had an opportunity to discuss amongst the individual teams and hopefully with each other the issue that were discussed, i.e. Whether there was going to be a claim for damages associated with Munchausen by proxy from the plaintiffs, and whether the defense had some further statement or clarification as to whether it was contending or not contending that Maya Kowalski did or did not have or does not have CRPS. So who's going to lead us off in this little discussion?
Since I was on the spot on Friday, I will. We filed last night a memorandum in response. I have a paper copy here for the court.
Is this the one about basically moving to conform the pleadings if we start talking about Munchausen by proxy?
As alternative relief, yes, Your Honor. So
I have read that one.
Okay, well then, I'll be succinct. Our position is we are not currently seeking damages for the diagnosis or mere suspicion of Munchausen by proxy. We attempted to do so. That claim was brought for Beata Kowalski in our count 17 for medical malpractice. The defense filed a motion for summary judgment. They prevailed, arguing that they had made no such diagnosis. She was never a patient. Their licensure prevents them from treating or evaluating people older than 22, and that Munchausen by proxy, if it appeared in the records, was a mere suspicion. So for all those reasons, we are not and have not sought damages in this case for Munchausen by proxy. None of our psychiatric experts testified to anything relevant to Munchausen by proxy, the diagnostic criteria, anything of the sort. So we object to the admission of evidence at this point of Munchausen by proxy or documents aimed at shoring up suspicions of Munchausen by proxy. If the defense prevails on this argument, then we do move to reassert count 17 and move forward with a medical malpractice claim for Beata Kowalski.
Please, the court. I'll take these in order if you wish. The first thing I heard was a question of our position with respect to the question of whether there is CRPS here. I'll address that first. Our position is and has been that Maya Kowalski does not have CRPS, that she has a psychogenic disorder of some sort, and that is what we suspected at the time of hospitalization, and that is what we had charted throughout the hospitalization. Throughout the hospitalization, however, we never ruled out CRPS. It cannot be definitively ruled out. As a matter of fact, I'm sure you'll hear one of our experts cross-examine tomorrow with an observation in his report that while he does not believe that she had CRPS, it cannot be definitively ruled out, or at least reasonable minds can differ with respect to that. The point here is, however, and has been, that the treatment rendered for the purported CRPS was inappropriate. That was suspected at the time of hospitalization, and that is our position to this day. The point here is that this patient had a pain syndrome of some sort, and whether it was CRPS or whether she was a victim of Munchausen by proxy and or had conversion disorder or some other psychogenic pain syndrome, the point remains that the treatment for those conditions is the same. The standard of care treatment for those conditions is the same. Whether it's CRPS, a pain syndrome associated with Munchausen's, or conversion disorder, or some derivation of the two or three, the treatment is all the same. That's where we are coming from. That's where we've been. Now, as far as the Munchausen's by proxy is concerned, I would direct Your Honor's attention to what plaintiffs have indicated is the 8th amended complaint. In paragraphs 27 and 28, there is an express allegation that we were remiss in diagnosing Maya with a variety of psychiatric conditions and alleging that none of them were treated. There's also an allegation that with reference to Munchausen by proxy in that same paragraph, and another in paragraph 130. In opening statement, counsel indicated that the plaintiffs were going to prove that the allegations that Beata Kowalski was trying to harm her children, both Kyle and MK, caused her in the end to, quote, lose control of the maternal instinct and resulted in suicide, unquote. There are multiple other references in opening statement to the same type of allegation. The allegation that Beata was wrongfully accused of Munchausen's or of attempting to harm her children or taking inappropriate care of her children goes to the heart of plaintiff's allegations of intentional infliction of emotional distress. The point that is being made throughout here, we think, by the plaintiffs, is that these allegations against the defendant, are the soul of the case. They can't run from that, Your Honor. And preventing us at this point from proving up, as we intend to do today and tomorrow, that Munchausen's was a reasonable suspicion, if not the correct diagnosis, goes to the heart of the defense.
But the diagnosis goes to mom and not to Maya.
That is correct, Your Honor, but it's material to Maya for this reason. Munchausen by proxy may well be, and probably is, an adult diagnosis. It's a diagnosis of the perpetrator. But we have to treat the victim. Maya has Munchausen by proxy. The point is that she's a victim of Munchausen by proxy and or a conversion disorder that is associated with it. That was what was thought at the time. That is what we think today. The question of whether there is a diagnosis of Maya personally, her individually, with Munchausen by proxy is a red herring. The point is that syndrome, we believe there was reasonable cause to suspect and conclude existed, and that it was influencing what was happening and being exhibited in behavior by Maya. That's the point.
And what were the specific allegations in the Eighth Amendment complaint that you referenced?
In paragraph 128, let me make sure I get them all here, Jeff. While Maya, under paragraph 128, while Maya was under its care, JHACH failed to develop a coherent treatment plan for Maya, with its doctors and staff consistently denying Maya's CRPS diagnosis and instead diagnosing Maya with a variety of psychiatric conditions, none of which were treated. Even when advised by pain physicians at other medical institutions that JHACH's approach and diagnosis were inconsistent and mutually exclusive, JHACH failed to correct its approach to Maya's care. In early January, as JHACH was hell-bent on painting Maya as a psychiatric patient while still maintaining to the dependency court that she was a victim of Munchausen by proxy, a physician at Kennedy Krieger grew frustrated with the management team and physicians during a call and advised that, quote, Munchausen and conversion are competing disorders and JHACH needs to pick one. That this did not occur to JHACH as they persisted in their unsound approach is a breach of the highest order. Now that,
So I asked what paragraph cite. Can you just tell me what
I'm
paragraph?
sorry, yes, that's paragraph 128 I just read. Sorry.
Okay, no worries. I just want to know so I can go back and read for myself.
Okay, sorry.
So just tell me
And
whatever
you might-
specific allegations that you want me to look at.
And you might also consult paragraph 129 and 130, as well as paragraph 131 and 132. Now that's in the operative Eighth Amendment complaint. If you refer to the opening statement, you will see the passage that I just referred to, as well as a number of others. We did a word search over the weekend of the plaintiff's transcripts that we have thus far, not all of them. We see 64 references to Munchausen's by proxy in the plaintiff's case. The idea, the central point of the overarching allegations, as I understand them to be, and as the defense has developed its case, are essentially twofold. Number one, there is an allegation that we failed to appreciate and honor, if you will, a diagnosis of CRPS that this patient had received from essentially 2, if not 3, outpatient physicians. We were alleged to have been negligent in not recognizing that diagnosis, accepting that diagnosis, and continuing the care of that diagnosis as had been outlined by Drs. Kirkpatrick, Cantu, and Hanna, which that we believed to have been destructive and dangerous. But the allegation is that we failed to proceed with treating her in accordance with that diagnosis and that treatment plan. The secondary allegation is that instead of doing that, we suspected a psychogenic component to her presentation. We suspected a psychogenic component to the way in which she was presenting her pain syndrome, as did, by our count, approximately 40 other physicians at 2 other institutions, at Lurie Children's and Tampa General, that we suspected that there was Munchausen's by proxy and or conversion disorder and or factitious disorder, depending upon which of those you subscribe to. And there's a good deal of controversy about them that Your Honor is about to hear a good bit more about. But the point is that the soul of their allegation against us is that we suspected the psychogenic constellation of presentation symptoms, and that was a deviation from the standard of care in the way we pursued that and allegedly failed to properly treat it.
Let me attempt to articulate some thoughts I had that I've been spending over the weekend trying to coalesce into something hopefully articulable. Assume for the sake of argument, Mom had Munchausen or whatever of those terms you wish to apply. So just assume that to be true. Does that change anything with respect to how the hospital should be treating its patient, who is not the mom, but Maya? And I just as, let me back up. The question of whether mom has Munchausen, to me, sounds like something that would have been front and center in the dependency court on the medical neglect, medical abuse case. In the dependency court, of course, that we're not trying the Chapter 39 aspect in this case. Just like the jury knows that DCF was involved and there was a dependency court, it knows that the position of Johns Hopkins All Children's Hospital was that mom had this. But in this lawsuit, do we need to prove whether mom had it or not? And that's what I continue to struggle with, because it doesn't seem to me that it really goes to your medical malpractice case. And I was thinking over the weekend, like, well, does it go to your defense of the intentional infliction of emotional distress count? And obviously, I think the concept that you believed that to be the case, that mom did have it, I think is relevant. But at what point do we need to keep going on and on and on and trying to prove mom has Munchausen? Because even if that's true, how does that change what was done or not done to Maya in this case? Now, I think you've got some traction with me in the intentional infliction count, but what started all of this is a whole series of emails and possible blogs about what was going on with Maya that doesn't seem to have anything to do with medical malpractice, but perhaps it does with intentional infliction. That's kind of the dichotomy. So if you'd like to comment on my rumblings there, I'll give you a chance. Because ultimately I need to make decisions on admission of evidence.
I understand, Judge, and I'm kind of flabbergasted.
Can I make one comment as a person who understands the DCF part of this?
Well, once I do that, Mr. Altenburn, then I'm opening up, and I was trying to keep us more focused on proceeding forward. Mr. Hunter.
Let me start by noting that based upon Your Honor's rulings, this is not just a medical malpractice case. A lot of it is a medical malpractice case, no question. But it's a battery case, it's a false imprisonment case, it's a negligent infliction of emotional distress case, it's an intentional infliction of emotional distress case. Over and over and over again, we have heard from the plaintiffs this evidence sponsored, that evidence admitted on the basis that it went to the plaintiff's or the decedent's state of mind. The decedent's state of mind is what caused, allegedly, her to commit suicide. Her state of mind was created, allegedly, by what? By her daughter's disease? Probably. But the allegation against us is that we created her state of mind. And we created her state of mind by doing as was suggested in opening, and that is that we were suggesting that her actions and her approach to her child's disease was harming the child. We're accused, they, that includes we, and there's been confabulation about that. They, we, are accused of separating the child from the mother. Why? Because of the allegation that the mother was doing harm to her child. That allegation is based around Munchausen by proxy. The defense of this case, with all respect, Your Honor, whether it's malpractice, whether it's false imprisonment, whether it's any of these things, all of the defense of this case rests upon the proposition that the pattern and practice of therapeutic and maternal behavior here was dangerous and inappropriate to this child. And that is why reports were made. And that is why suspicions were hatched. And that is why we attempted to act as we did with respect to the discharge of the child or the lack thereof, and the circumstances under which we attempted to treat her and to transfer her elsewhere for more treatment in accordance with the standard of care. But we cannot defend our case, Your Honor, without the idea being a centerpiece that it was reasonable for us to suspect that there was a Munchausen by proxy or a factitious disorder by proxy going on here, and that we were reasonable in suspecting that, and that we were reasonable in acting upon that as we did, and attempting to treat this patient as we did. That is central to the defense of the case. If you emasculate that, you've emasculated our defense. And I don't know what I can tell you beyond that. What you're going to hear today is from a witness who months before we ever saw this patient suspected the same thing. We believe that to be directly relevant to what we did, what we suspected, and how we did it. You're going to hear from our treating physician, Dr. Elliott, one of our employees, about what he encountered, how he responded, what he did. You're going to hear from an expert tomorrow that will pull all of this together, we hope. But I have to tell you, Your Honor, this is inimical and central to what they've alleged against us and to our defense against it.
Let me hear from Mr. Whitten, and I will tell you what I'm hearing about, at least with respect to the intentional infliction of emotional distress count, that there may be some need for some of the evidence that was being discussed on Friday afternoon. So, Mr. Whitney, let me hear from you, and then we'll move on.
Well, I'll start there with the intentional infliction of emotional distress. The contours of the hospital's conduct and Ms. Kowalski's conduct and what was not allowable and what was allowable with respect to her visitation or their supervision all goes to Chapter 39. So what we've brought forward on intentional infliction are things that have nothing to do with Munchausen by proxy. Catherine Beatty sitting in on phone calls. Catherine Beatty telling Jack to divorce his wife. Catherine Beatty saying that she's going to adopt Maya and be her mother. None of these things have to do with Munchausen by proxy. Listening to Mr. Hunter, the phrases that he uses give away that the Munchausen by proxy is wedded to Chapter 39 proceedings. He talks about justifying the separation. Justifying the separation is what they were doing in the dependency court. And those orders separated the mother and child, but there's no need to justify the separation unless we're going to relitigate the Chapter 39 proceeding. He talks about suspicions. He talks about reports, hotline reports. These all go straight to Chapter 39. Even the allegations he points to in our medical malpractice claim in paragraph 128, Munchausen and conversion are competing disorders. When we tried to introduce that note out of the risk management file, it was excluded because it was central to Chapter 39. In paragraph 130, the mention of Nurse Ashley stating that Maya exhibited textbook Munchausen. Yes, that's in our claim, but the court's been drawing lines, and one of the lines it's drawn is that the hotline reports are out. Nurse Ashley's characterization as textbook Munchausen is in the first or the second hotline call. That's not part of this case. Even if the defense was allowed to put in all of this evidence, they can't close the loop. They have no expert on causation. They have no expert on it. They don't have an adult psychiatrist. They would need an adult psychiatrist. There's no dispute about this. The DSM-5 says the perpetrator receives this diagnosis. It's the adult. They would need an adult psychiatrist to come in here to close the loop. The context of 64 references to Munchausen by proxy in our case. There's no specific citation, and I did not review the transcripts that they have. But the court will call the Munchausen by proxy term is what was thrown around in that transfer diagnosis to Nemours in the midst of the dependency proceeding. So I'm willing to wager that 95% plus of those references to Munchausen by proxy are specific discussions around that transfer diagnosis and the reasons that Jack and Beata declined transfer under those circumstances. Nothing about our experts getting on the stand and making arguments or opinions about whether Munchausen by proxy was or was not the appropriate diagnosis. And lastly, on the psychogenic constellation of Maya Kowalski. The psychogenic constellation of diagnoses of Maya Kowalski does not include Munchausen by proxy. It cannot. The psychogenic constellation of Maya Kowalski has to do with what their psychologist diagnosed, Dr. Katzenstein, who I think we hear from today, psychological factors affecting other medical conditions. That's the DSM-5 diagnosis of Maya Kowalski, confirming that she has CRPS, but she has a psychogenic overlay on that. The other diagnoses they entertained for Maya Kowalski in this psychogenic constellation are factitious disorder, not factitious disorder imposed on another, but factitious disorder of Maya Kowalski, and conversion disorder. So there are at least 3 diagnoses of Maya Kowalski that they threw around that compose this psychogenic constellation. None of them are Munchausen by proxy. They go specifically to Beata. So again, if Mr. Hunter's argument persuades this court, we move to reassert count 17, because now they're claiming they did make a diagnosis of Munchausen by proxy. They want to argue all about it, and so we want Beata Kowalski's medical malpractice claim back.
One other point.
Are there other issues, because it's getting close to 9 o'clock, other issues that we have to address before we bring in this jury?
I don't believe so, Judge. I just point out that as counsel just made reference to, an inimical point of the false imprisonment claim is the fact that there was a transfer offered, there was a transfer that was put together, you're going to hear more about it tomorrow morning, and it was refused. Why was it refused? Because of that diagnosis. Because of the because to almost directly quote, we would be admitting to Munchausen by proxy to child abuse if we signed off on those transfer papers. They put this in the case from day one, Judge, and they can't run from it now.
But okay, how does you proving that Maya did or did not have it change Beata's state of mind as to her decision not to sign the transfers concerning or when there was any sort of possible reference? And I think, though, that came later as opposed to the October date.
Yes, correct.
So, let's try not to conflate those. I'm having enough trouble keeping those two apart in my mind myself. But, I feel like I've clipped the plaintiff's wings very hard on trying to keep Chapter 39 out. And it just seems that now that I've done that, the defense wants to make this case in trying to prove that Beata had Munchausen, which seems to be the heart of what was going to be in the dependency court, which is what I was not letting in the plaintiff's case in chief.
With all respect, Your Honor, you have ruled on the Chapter 39, and to be honest with you, I have yet to understand where the dividing line is on this. But what I do know is this. What I do know is that the remaining case against us, whether it's the false imprisonment or the intentional infliction or the negligent infliction of the malpractice, is all bound up in in what we suspected and what we did and how we ruled on it, and the impact of that on Mrs. Kowalski's state of mind and on her conduct. And that's, I mean, if Your Honor tries to carve that out of this case, it eviscerates a major portion of the defense and puts us in a completely untenable position. I would suggest to the court that Mr. Whitney's argument is for the jury. It's not for admissibility. And I would urge Your Honor to let this go forward and let us try our case.
Are there other issues that we have to address prior to the jury coming in?
Well, Judge, the first witness is on this issue.
On Beata's, whether she has,
No, Judge, the first witness is Dr. Elvin Mendes of Fort Myers. Dr. Mendes saw this patient in October of 2015 and December of 2015. He was consulted regarding immunotherapy, and after 2 visits with this patient, he indicated in one of his conclusions that Munchausen by proxy should be considered, and he advised Dr. Wasenauer of that fact in a copy of a letter to him. The point of his testimony is exactly this, and the point of his testimony is, frankly, a point I thought I tried to make an opening, and that is that we stumbled upon this trail and followed it. It was not a new trail.
Mr. Altenberg.
2 completely unrelated things. I'm only here for a little while, hopefully, to find out, A, if you've looked at the instruction that you're contemplating on the visitation at all, because Mr. Elliott and I need to kind of get closure on that, because by Wednesday, we really need to have had that instruction read. The other thing I was waiting to see was how many counts were going to be gone or not on directed verdict, so I can finish the jury instructions.
Well, I don't have time to address that right now. Hopefully, after lunch, we can close the loop on some or all of the DV motions. So I don't know if you want to hang out until after lunch to see
I've
if
got a room I can type in all morning long. So.
And Mr. Whitney, anything else?
Well, 2 things. On Beata's state of mind and the relevance, the state of mind of Beata Kowalski that's at issue in this case is the irresistible impulse, effectively. And I would point the court back to their motion for summary judgment, again on count 17 at DIN 1933, in which they made a big point of pointing out that she was admitted to Sarasota Memorial Hospital the day of the dependency proceeding when she fainted in court, and that at that time she denied ideation, and that as of that date she did not have ideation. So her state of mind deteriorated over those next 3 months, irrelevant and irrespective of what Dr. Mendes may have thought in October of 2015. I think we need to argue this Dr. Mendes issue.
Well, I think with Dr. Mendes, I'm going to be consistent with what I did with the prior treaters that saw Maya prior to the admission to Johns Hopkins All Children's Hospital, and kind of let that type of testimony in, because it does set the stage as to how Maya presented at Johns Hopkins All Children's Hospital in October of 2016. So I think the historical stuff, at least I'm going to continue to rule like I did with Lurie's doctor and the Tampa General Hospital doctor. I'm just going to stay consistent. If I'm going to change how I'm doing something, I'll let you know. But for now, I'm going to remain consistent as to how I ruled with respect to those 2 hospital visits.
May I make a record on that?
Sure.
Well, we believe, again, this is Chapter 39, issue 403. and irrelevant to the claims in this case. I'll point out again, at the time Maya Kowalski was hospitalized at Johns Hopkins All Children's Hospital during the false imprisonment the first week, they did not have any knowledge of Dr. Mendes's records.
I don't think it's going to false imprisonment. I mean, I know it's been banning about, but I don't see how it goes to false imprisonment. I am, frankly, the only place it really seems that it possibly fits is the intentional infliction count. I still don't understand how it would fit with medical malpractice with respect to Maya.
All right.
But, I mean, I do think, and I do have some belief it does go to the defense of your IIED count.
Understood. We disagree, but we understand.
Okay. So are we ready to bring in the jury? Let's bring in the jury. Good morning.
All rise. Jurors entering.
Okay, welcome everybody. How are we doing on a Monday morning? Great. Glad to hear it. And were the best birthday festivities fun?
Yes.
I want to confirm, while you were away over the weekend, you did not discuss this case amongst yourselves, you did no investigation, and you received no information. Is that all correct?
Correct.
And since you were last with us, has anyone seen any news accounts of this proceeding? And has anyone approached you about this case since we were last together? Mr. Hunter, your next witness, please.
Okay, please go with the honor. The defense calls Dr. Elvin Mendes.
Mr. Clark, can raise your right hand?
Do you solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, nothing but the truth?
I do. Right this way, sir. See that witness standing over there.
Good morning.
Good morning.
Would you tell us your name, please?
Elvin Mendes.
And what is your occupation, Doctor?
I'm currently a physician with Lee Health in Lee County and Charlotte County.
Okay. And where is your practice?
We have two locations, one in the Port Charlotte area and a second in Cape Coral.
Okay. And what is your specialty, sir?
Allergy immunology.
Would you give the jury the benefit of your background and training and education starting with undergraduate school?
I trained as what they call a foreign medical graduate, so we do undergrad and med school in one 7.5 year stretch. So this was done in the Dominican Republic. I came to the U.S., trained in pediatrics in Long Island, and then moved on to Einstein and did allergy immunology. After that, I joined private practice for 4 years, joined the non-for-profit for another 4, and then we headed south to Fort Myers. We've been in Fort Myers now, Charlotte County for about 21 years now, and joined Lee Health in 2015.
Okay. And I'm sorry, Dr. I missed, where did you do your residency?
In Albert Einstein College of Medicine, New York.
In New York City?
Yes, sir.
Okay.
I'm sorry, that was my fellowship. My residency was done at NASA University Medical Center in Long Island, New York.
So you did both your residency and your fellowship training in New York
New
City?
York, yes.
Okay, in Greater New York. And what are you board certified in, sir?
I was board certified in both allergy, immunology, and pediatrics. After years of allergy, immunology, I decided to give up my board certification in pediatrics. For no particular reason, I just continued doing allergy, immunology through the last 20 years.
And could you tell us what allergy and immunology entails?
Okay, so from an allergy standpoint, it's we deal with a variety of different organ systems that have an allergic or immune mechanism involved. So, for example, make it easier, head to toe, sinus disease, nasal symptoms, sneezing, congestion. That's the one that we see most commonly in the offices. We also deal with skin disorders, but they have to be specific allergic skin disorders. From the lower airways, in other words, further down, then we deal with asthma and asthma-like symptoms. There are some occupational lung diseases that we may deal with when they're exposed to certain chemicals. And certainly there are other organs that are involved specifically with allergy, for example, GI or gastrointestinal system. There's a variety of not only food allergies, but also diseases that are associated with that. That's the bulk of the allergic side. The immunologic side is a little more complex. There are mechanisms that we deal with that encompass both the allergic and immune world. It's not just immune deficiencies. There are a lot of overlaps with rheumatology, so there's some autoimmunity that we may deal with. Certainly, it gets to a point where we then end up referring to rheumatology. So immunologically, it's predominantly immune deficiencies that we deal with in pediatric and adults. Bless you, sir. And from a allergic standpoint, there's often an overlap between one and the other, because some individuals with immune problems may present with what appear to be allergic problems. Okay. But it's one same field.
Okay. And does it also deal with immunodeficiencies?
Yes, sir.
Okay. Has there come a point in your practice with Lee Memorial Health System that you became involved with the care of Maya Kowalski?
Yes, sir.
Okay. And when did that take place?
I saw her twice. The first time was in October 28th, 2015.
Okay. And do you have your notes with you, sir?
It's in my head. Yes.
Okay.
Yes, sir.
Okay. Well, if for the record, that is Defense Exhibit 3031, and it starts with 002. So if you want to put that up, I believe that's in evidence. And if you need to refer to that to your records, if you'll let us know, we can scroll down through.
Absolutely.
But for now, could you tell the jury how it was that the Kowalskis came to see you in your practice?
The original visit on the schedule was for a second opinion for immune deficiency.
Okay.
Do you want me to dwell on that, or?
Yes, sir.
Okay. So, so this is my. Just looking for a date here because we saw her twice. So this was our first visit, and there was a different reason for the second visit, and we'll get to that later, I'm assuming. But for the first visit, it was on schedule as a second opinion for immunodeficiency.
Okay. And what was your understanding of where the patient had already been with respect to immune deficiency questions?
I'm sorry, could you elaborate on that question more specific?
Well, you were asked for a second opinion, and I'm trying to find out who the first opinion was, I guess.
So when you call our offices, we're going to want to know why you want to see us. Someone offered that information to our staff. That's all that was on our schedule. It actually says second opinion for immunodeficiency. Okay. The idea is that they're coming to see me because they are perceiving they may have a problem with immunity.
Okay. So when did you take a history from this patient, and was she accompanied by her mother?
I'm sorry,
was she accompanied by her mother?
Yes, just her and her mother, yes.
Okay. And did you take a history from her?
Yes, sir.
Okay, and what did you find out from the history?
Overall?
Yes.
Complex. There were a lot of things going on.
Okay. Generally speaking, what history did you get from them?
You want me to be specific, sir?
Yes, sir.
Okay, so we cover quite a bit. Just because someone comes in with a concern about immunodeficiency, there's a lot of questions I ask because, like I said earlier, immunology and allergy do kind of overlap. So you'll see in the notes, or perhaps I don't know if it's been discussed before, that there are questions that don't seem to even correlate with what they originally came in for. But there are reasons why we do that. So to answer your question, we covered quite a bit of organ systems. So That's a review system we do and we cover. And if there's anything striking within that review system, we will dwell on that particular problem. So she did all the talking. She was a great historian, I gotta say. She was very bright. So it was easy. I hate to tell you, an immunologist, not an easy thing, but she was really good. So I was able to obtain the history on her part with regards to, because I did ask why a second opinion. And she said she wanted information on her daughter's immunodeficiency. Unfortunately, I had nothing at the time, just her history. So I had to request records.
And did you conduct an examination of the patient that day?
Yes, sir.
And what did you find, if anything?
So two things. The first thing that was striking was that she appeared to be in pain and a lot of discomfort. She was wheelchair bound, by the way, in my office. And I remember her very well because she was sitting literally next to me. And the mother was just facing me here. And she appeared to be in pain. And the only way I can say this is because she was kind of moving around on the wheelchair and some sounds were made as if she's in pain. So, but I was able to examine her. I did not elicit additional pain. I do recall that because I'm very cautious about pain. But I did not perceive or rather induce any additional discomfort during the examination.
Okay. Did you find out in the course of all this what other immunologists or allergists she had seen?
Yes. So at some point during the history taking, it appeared that she had already seen actually 2 additional allergists.
Okay. And did you get any understanding of why it was or how it was she had come to see you?
No, sir. Her answer to me, and again, this is recollection from my notes, not recollections that because this was about 8 years ago, was that she was just seeking an answer to her daughter's immunodeficiency.
Okay. So at the end, well, did your examination include an examination of the skin?
Yes, sir.
Did you find anything unusual or untoward?
No, sir. That I can recollect, no.
Okay. And what, at the end of your first consultation with this patient in October of 2015, what was your plan? What was the follow-up, if anything?
Several things, because there was a lot. It wasn't just immune concerns, so obviously I needed those records from the other allergists she had seen before. There was also so when we look at an immune deficiency, we want to determine if we can figure out what the cause is. You know, is this something that she's had since she was born? Is this something that she has acquired since she was born? So we need to inquire about things that may induce what we call a secondary immune deficiency. So other medications that she's been on. So we requested records from other physicians that had seen her at the time. So I have a sense of whether this was induced by other things that may have been given to her. What was striking in her history is that she had been through numerous ER visits, numerous physician visits, and a lot of steroids. And that's, you know, to an immunologist, that's striking because steroids are a double-edged sword. They solve a lot of problems, but they also can induce a lot of problems. So I wanted to make sure that this wasn't secondary to medications. So to answer your question, it wasn't just focusing on immunity and getting records from the allergies she had seen in the past, but also perhaps some of the other areas that she visited that may provide me some information, some insight, especially lab work.
Okay. Now, when you took a history from this patient, did you get any indication that she had been in Tampa General Hospital for about 4 weeks?
No, sir.
Did you get any indication that she had been seen and worked up at Lurie Children's Hospital in Chicago?
So that's a tough question. So yes, and we're referring to prior to moving to the state of Florida or after?
After.
No, I was not aware of that.
When did you see this patient in follow-up?
It was the second week of December of 2015. Actually, it was on her birthday.
Okay. And I believe that's Defense
December
Exhibit
10th.
3031-007, not the James Bond, but the page number. If you need to look at your note, Doctor, I believe you'll see it there.
Yeah, okay.
When you saw her in follow-up in December, what additional history did you get at that time?
So the first part of the that page just gives you a kind of a summary. I tend to do that for providers that might want access to the notes. So it kind of just summarizes what has transpired in the initial visit, and then I move on to anything that's new since we've last seen them. At that point, we did have records received because we had requested several, and I believe it was at that time that I may have received notice between the first allergist she saw and the second visit to the first allergist, which was Dr. Wyndham. There was a lot that went on in that period of time, and someone wrote a note that she had been to Lori Children's for another opinion. I think it had to do with her cortisol level. So there was some concern that there may have been adrenal suppression. When you go on high dose steroids for extended periods of time, you will literally suppress your adrenal gland. Your natural cortisol is produced by an organ within your gut cavity. The brain sends signals to that cavity, to that organ, to tell it produce more, produce less. But if you give it outside long enough, it'll stop sending that signal. The problem with that is if you stop administering that steroid, you'll go into adrenal shock. So it's a dangerous situation to be in. So I'm assuming that they were seeking a second opinion at Lori Children's because that was the hospital when she was a child and growing up in Chicago. But I'm not sure if that was true. I don't have any records of that.
Okay, so you never saw any records from Lori Children's?
Just mentioned on one of the notes.
And you were never told what the discharge diagnosis from Lori Children's was?
No, sir.
Okay. And I'm assuming you were never told what the discharge diagnosis from Tampa General was?
From?
Tampa General.
I wasn't aware of the Tampa General. I'm sorry, let me correct myself. All I heard was that she had undergone rehabilitation at Tampa General.
Okay, and were you aware of the discharge diagnosis?
No, sir. I just was told there was rehabilitation at Tampa General, and it had something to do with her cortisol level.
Okay. When you saw her on this day in follow-up, did you do an examination at that time?
Yes, sir.
And what did your examination reveal?
Completely normal physical examination.
Okay. Did you note any color changes or rashes on the skin?
No, sir.
And did you get any history of any episodes of dizziness or weakness or lightheadedness with the patient?
The second visit, I don't recall that coming up as a part of the history. The first, there was a persistent headache throughout the visit, on the first visit, and I believe there was also dizziness described.
Okay. Now, did after you had conducted your examination and your history and physical, and you looked at some records, I'm assuming, from her past care, did you arrive at any opinions or conclusions regarding her immune status?
First or second visit?
Second visit.
Okay. Yes, sir.
And what was that?
That she... May I explain?
Yes, sir. Yeah, you're the only one who can.
Okay. So...
Objection to narrative response.
Overruled.
There are numbers that we follow in any lab work that you have done. I'm sure some of us have had those done, and there are some values that are considered above normal or below normal, and the lab does that. It gives you a certain range. So if you go to one lab, you're going to get one range. You go to another lab, you get another range, and typically we follow that as a tool. It helps guide us to determine whether it's a problem with your liver, spleen, or an immune problem. With immune deficiencies, there are international standards that we follow or try to follow. There are also some national standards that we follow. The numbers, when you look at a lab, may appear to be grossly abnormal. Okay, so you'll have I'm just going to make a number up for y'all folks. Let's say, the normal for a 9-year-old of an immunoglobulin G should be, according to the lab, 600 to 1200. That's what they'll put on as a normal. 600, low, 1200. Now she's at 550. Is that considered abnormal? Okay, so that's the question that you ask the immunologist. My short answer is it's not abnormal. And the reason for that is because there's very specific criteria that we have to follow to determine whether an individual has a deficiency or not. And if I may, just briefly to the jury.
And while you're doing that, I'm going to ask that 3031-009 be put up. That's where your lab values are, in case you need to refer to those.
Okay, so
Down at the bottom.
right, I see that. Okay, so I want you to see that there were two numbers that were given to us. And the reason two numbers during the same lab draw are different is lab. So one lab, the same lab did the total IgG, the immunoglobulin G, the total, and then something called subclasses. So total IgG is broken down into 4 components, and they're numbered 1, 2, 3, 4. Okay, so one set of numbers gives you a low total with a low IgG 1 and 2. That was the subclasses that were done. On the other hand, the doctor also ordered separately a total IgG. Now we have two discrepant numbers, one same draw, same person. So we have a 575 on one number, and we have a 603. I see those numbers and they're staggering because there's a significant difference between one and the other. You know, one of them appears to be not grossly abnormal, but just decreased, and the other one appears normal. So just for the record, these two numbers are normal for an immunologist. But so criteria number 1 is you take that, you measure that value. You want that immunoglobulin G. Yes, you can order the subclass because oftentimes one of them will drag the total down, right? Because the top is the sum of all the little ones. But the general consensus, and these are International Immunology Society regulated rules.
Objection bolstered.
Sustained.
They have to repeat it again.
Hold on a second. Let Mr. Hunter ask another question.
You can't make reference to outside sources.
I'm sorry. Apologize.
So if you just tell the jury what these labs meant based on your experience and training.
Sure. So based on my experience, a single digit is just a reason for me to wait, based on current standards, a minimum of 2 to 3 months and repeat them again. Because standards are, there has to be a minimum of 2 separate draws with a minimum of 2 to 3 months between each. But that's just one of 3 criteria.
Okay. So at the close of all this, and your second visit with this patient, and the labs and records and so forth that you had the opportunity to review, did you arrive at any opinion or conclusion that you were able to share with the patient and her mother regarding whether or not she had an immunodeficiency?
I was, yes, sir.
And what was that opinion?
My opinion was that either Maya had something we call transient hypogammaglobulinemia of infancy and childhood, which is a transient type of deficiency that we see, and it normalizes over time, or that she did not. Personally, with a normal immune response to the vaccines that she had and the rest of her lab work, to me, she was normal. She had no other immunodeficiencies. Typically, you have other immunoglobulins that are reduced. You don't have an adequate vaccine response. Those are the other 2 criteria that are required for you to be diagnosed as a immune deficient. So I explained this to her at that visit.
And to state that a different way, did you determine that she had any immunodeficiency that required follow-up treatment?
No, sir.
Okay. Did you arrive at any other opinions or conclusions regarding her condition and matters that should be addressed in her care?
Yes, sir.
And what were those?
Okay, so the first is, we'll start from Morgan Systems. The first is this asthma history. We deal with asthma. That's part of our training as well. We rely on tools to help us make a determination whether someone has a disease or not. We do that with every disease. The reason why we rely on tools is because we have to have not only the history provided by a parent or a child, but also we need to have some objective measures. You have to always have something to help you guide you and determine whether there's a disease there, because there's a lot of mimickers of asthma, lots of them, and nothing added up here. Pulmonary function tests were normal. I was only unfortunately able to see one, that Dr. Kreisman, who's a pulmonologist, or I'm not sure if he's still at All Children's, put on in the records. And there's also mentions of normal pulmonary function testing throughout the visits. So from a respiratory standpoint, unfortunately, I could not make an intelligent decision that she actually had asthma. That's the first thing. With regards to the allergies, yes, Maya had allergies based on skin testing performed by an allergist, but to me that was secondary. At the time, I think we were dealing with much bigger medical problems that I think needed to prioritize over allergies.
Okay.
And then the last item, with the concern about the chronic the CRSP, is I'm not a neurologist. She talked about RSD. She talked about a lot of problems, neurological problems that might be wrong with Maya. I specifically told her that was way outside of my wheelhouse, and I'm out of my lane, and I'm not an expert on that. And she'd have to talk to her primary care or neurologist about that.
Okay. Were you aware that her primary physician was Dr. Wasnauer?
So I only was aware of Dr. Wasnauer because his name comes up. Our records, we provide all primary doctors with notes. Whether you refer them to us or not, as a courtesy, every primary doc gets a letter. Sometimes the patients will not provide us that name, so it's just left blank. But as a general rule, they do give us the name, and we provide them with a letter. So that's the only knowledge I have of him, because he did get my letters. We did request records from him and never received.
Okay. And did you send him any information about your consultations with this patient?
Every visit, yes. And our assessment, yes.
Were there any other considerations that you called to his attention?
Yes, sir.
And what was that?
So physicians are trained to be alert on anything that might be of, should we say, harm to a child. Right? Any risk, any concerns that may come up during a visit. It could be a variety of different things. The one item that was of concern at the time because of some events, some things that I saw during the office visit with her, from my reading of the documents I received prior to her second visit, I can only use the word did not add up. And so my concern was that this might be fictitious and not true events that were occurring. Either way, I wanted the primary doctor to dwell further and see if there is a neurological problem with her or not. I was basically telling him, hey, you need to find out if this is true or not, because this is harmful for her. She's wheelchair bound. She's in pain in my office. And that's the last I've heard of the Kozlowskis.
And so what specifically did you call to Dr. Wasnauer's attention in that regard?
I'm sorry?
What specifically did you call to Dr. Wasnauer's attention in that regard?
So I was concerned about Munchausen by proxy at the time.
Okay, and why was that?
Because the symptoms, the physical examination, the objective tests that I've reviewed in medical records did not correlate with the story I was getting from mom.
In what respect? Can you be more specific?
So there was a constant. The first is the numerous lower respiratory complaints, the asthma picture, the severe asthma. And that was used a lot in a lot of the notes. Severe asthma, severe asthma, severe asthma. Like I said, in my experience, we have someone with severe asthma admitted to a hospital for a few days and comes out with normal breathing tests, completely normal spirometry. The lung doesn't work that way. I'm just being honest with you. When you get to a severe case, there are maybe some changes that take place within lung tissue. Your lungs will start over time sort of scarring within the bronchial tubes. That's why individuals that are not treated early on adequately will get worse over time. You can improve their ability to breathe with medications, but the breathing test was always going to show you some degree of changes in the lungs. There's always going to be there. I looked at the PFTs, the doctor from Old Children's, Dr. Kreisman, provided in his notes, and they were completely normal. So, and that was just one event. There were other severe asthma, and the most striking and most concerning was the numerous steroids utilized, both inhaled, oral, and in injectable forms in various ER visits, clinic visits, provider. And in fact, she actually had access to, I believe, to steroids at home that she could provide her at will.
Motion strike.
Okay, members of the jury, you are to disregard the last comment about home steroids. Mr. Hunter, you may continue.
Doctor, have we ever met?
I'm sorry?
Have we ever met? You and I ever met?
No, sir.
Have we ever spoken?
No, sir.
Your witness.
You gave a deposition in this case, you recall?
Yes, sir.
Right. And I guess you couldn't help but notice how emphatic you were here in front of the jury. You wanted to really convince the jury of what you were saying, right?
I'm sorry. Can you ask that question again, please?
Yes. I noticed you were quite emphatic. You were trying to convince the jury of things you were saying, were you not?
That's not correct, sir.
All right.
I'm going to sustain the objection.
After the deposition, when the different lawyers were still on the line for ordering the deposition transcript, I want you to tell the jury whether you had a discussion with one of those lawyers in which you said words to the effect of, "I did my very best for you. I hope I helped." Did you say that to him?
No, sir.
Objection, Your Honor. Proper impeachment.
I'm going to sustain the improper impeachment objection. You can continue along this line if you want.
Did you, I'm just simply asking you, sir, did you have a discussion with the defense counsel at the conclusion of the deposition while the lawyers were talking about ordering the depositions where you said words to the effect of, "I hope I helped you, I did my best to help you," or words to that effect?
Objection, Your Honor. May we approach and maybe show the witness what he's...
I do not recollect those comments.
The answer is we don't need to approach on that. Overruled the objection.
And you are aware, are you not, that...
He said he didn't recollect, so are you going to refresh his recollection, or are you moving on?
I have other evidence that will be as part of our rebuttal.
All right.
Witnesses. And you are aware that Munchausen by proxy, that reflex sympathetic dystrophy, and you know that's also known as CRPS, right?
Mm-hmm.
You're aware of that?
Yes, sir.
And you are aware that it is often misdiagnosed as a psychiatric condition, particularly in children, right? Are you aware of that?
So I understand the question correctly. You're asking me if I'm aware that CRPS is often misdiagnosed as a psychiatric condition. Is that the question?
Especially in children.
And my short answer is no, because you mentioned the word often, and I'm not sure that that's accurate.
All right. Well, certainly then you do keep up with the laws that come into effect regarding... I'm going to have to approach before I finish this question. but you are aware that Munchausen by proxy and other psychosomatic, that CRPS is often mistaken as a psychosomatic condition, a psychiatric condition.
So again, I respectfully disagree with the often confused with, and I'm not sure it's often.
Okay. Well, you are suggesting that you saw signs of Munchausen by proxy. Is that right?
What I said earlier was that I saw signs of symptoms that did not correlate with the treatment plans that have been provided in the past.
All right. And where did you get that information from?
From the records that were reviewed by that were sent to me by other physicians that had seen her.
Including Dr. Kreisman?
Yes.
And Dr. Kreisman, I assume you determined, was the primary prescriber of the steroids?
I disagree with that comment as well. I'm not sure he's the primary prescriber. I just know he's one of the treating physicians.
Well, was he a prescriber of the steroids or not?
On the notes that I read, I do not recollect that, no, sir.
Okay. Now, if you needed to know about whether a child had asthma, actually witnessing it would be a good idea, right?
No, sir.
You don't need to witness the actual cough to know whether or not a child may have asthma?
There's a lot of other causes of cough, sir, that are not necessarily asthma.
Mm-hmm. So if I were to show you an actual cough of the child, would that allow you to see whether or not this child had asthma?
Would not, even if you showed it to me.
Okay. So would a diligent parent seeing a very disturbing cough be doing the right thing to bring it to the attention of a physician?
I totally agree, yes, sir.
Overruled on that one.
And then, if we could, with the courts, it's in evidence, show Exhibit 2616.
It's in evidence, yes.
Could you not clap, please?
While you're finding it there. Okay.
Be strong.
Now, with a 9-year-old girl exhibiting a cough like that, you would agree that it would be reasonable for a parent to want to search for any possible causes, would you not?
Yes, sir.
So, Beata Kowalski, by trying to find the solution, if you will, that is the correct diagnosis and treatment, that would not be unusual, would it?
I'm sorry, can you repeat the question again?
Beata Kowalski, as a parent, hearing a child with that level of coughing, it would not be outside the bounds of normal parental behavior to try to find out the source of that cough, true?
Would not be, no.
And it would not be beyond the bounds of normal parental behavior to try to find a treatment for that cough, would it?
You're talking about professional treatment? No, not at all.
And so, in going after and trying to find this out, she would not be doing anything that you felt was inappropriate, right?
At this point, from where I heard that cough, I'm moving forward? No.
All right. Okay. So, what is certainly you've talked about here and felt strongly enough, I guess, to write a letter. But by the way, did you ever talk to Dr. Kreisman about your concerns that this might all be psychosomatic?
He's not the primary physician.
Did you ever talk to Dr. Wasserman?
I sent him a letter twice explaining that.
Well,
the first, second time, rather.
If you were really, and so you didn't get a response, right?
Did not, no, sir.
All right. And you never called anyone from the state, did you?
just because I suspected, with the information I had, I personally at the time I did not feel I had to report it. I wanted the primary to be aware of it.
My question then is, did you call the primary care physician and have a discussion with him?
No, sir, that's not customary of me. Not in that situation.
I thought you testified on direct that it was customary, that you would contact.
I specifically said, if we go back to what I said, is that every physician, primary care physician, receives correspondence from me on every visit that I see in my office. The only exceptions are when a patient does not, or parent does not give us the name of the primary care physician.
Tell us then what the facts there that you took from the history with Beata Kowalski that were significant to you, that she uttered to you there, either visit.
So I want you to explain to me what you mean by facts, sir.
Well, what were the key facts in the history that you found pertinent to trying to come to some conclusions, including this one?
That she has, her daughter has always been ill, that her daughter has been in pain from some neurological problem, that she has severe asthma, that she has an immune deficiency, and what else? And that she has allergies.
All right. And so, allergies. All right. And first, with allergies, did it come to your attention that other physicians had diagnosed her with allergies?
That is correct, yes, sir.
Did it come to your attention that other physicians had diagnosed her with asthma?
I did not have evidence to substantiate that.
Subsequently, did you obtain evidence of that?
I obtained evidence that did not show that she had asthma.
Did you ever talk to any of the physicians at Johns Hopkins All Children's Hospital to see whether asthma was listed as one of her illnesses?
My role in all this is to determine whether Maya at the time was immune deficiency. The rest of the information available in history taking is to determine whether there's some correlation between diseases and her apparent immune deficiency. So the answer is no. We do not proceed with any other disorder that I might encounter during my history taking. That is passed down to the primary care physician in writing.
I understand. And then she told you the child had pain, correct?
Pain and cramping on the legs, I believe it was.
And you said you inspected her. Counsel asked you about her skin. Did you look at her lower back?
No, sir.
Did you look at the inside of her thighs?
No, sir.
Did you look on the inside of her ankles?
Yes, sir.
Did you look then on her neck or upper back?
No, sir.
The inside of her arms?
Anything that was visible during office visit is what we usually put down. I'm not a dermatologist. My role is strictly what I can see. I'm not going to address a patient and do a full physical. That's out of my scope of my job.
So whether she had CRPS lesions at that time or not, you would not be in a position to state. True?
I'm sorry, whether she has...
CRPS lesions, you would not be in a position to state.
I am not familiar with CRPS lesions.
All right. And so then what was the final one there? The daughter had been sick, right?
Correct.
And you knew that the daughter had been taken, among others, to Johns Hopkins All Children's Hospital for various emergency room visits, correct?
I do not have that information, no.
Right. So, out of all of these, can you tell us now, do you know what DSM-5 is?
That's the most recent DSM, yes.
And what is DSM?
So the American Psychiatric Association has a manual, so to speak, that provides you with diagnosis code of various behavioral and psychiatric diagnoses. Yeah. They're up to the 5th edition.
But what does DSM-MD stand for?
Oh, if I can recollect, again, I'm not a psychiatrist. It stands for, oh my goodness, and I don't recall off the top of my head. I apologize.
All right. So having been raised concerns about this, tell us which of the 4 factors you focused on to come to the conclusion that Munchausen syndrome by proxy must be suspect.
Objection, proper impeachment, Your Honor.
Overruled. You can answer.
So which of the above is what you're telling me that I derived on? Obviously, the main reason for the visit was
Maybe I misstated. I'd like to know under the DSM-5 categories, the 4 primary categories for diagnosing Munchausen by proxy, or now factitious disorder on another.
Your Honor,
Which ones did you focus on?
one,
Your Honor.
And which one was that?
where there's no correlation between the symptoms and signs presented by the parent and the objective findings that you may have, whether it's radiology or lab work or whatever objective labs or procedures you have available.
The parent told you the child was ill, correct?
That's correct.
The child was moaning.
I'm sorry, the child was?
Moaning.
That's correct.
You had confirmed with other physicians that there are allergies.
What does moaning and pain have to do with allergies? I'm sorry, I lost that.
All right. Well, I'm just trying to find out which of these 4 now, we're talking about the DSM categories, which of these 4 are you saying that Beata Kowalski lied to you about?
So if you all read my notes, both notes, and I have to expand on this, Your Honor, if you don't mind.
Go ahead and answer the question.
To answer the question, I have to explain. He's looking at a very narrowed comment. You have to look at the whole visit. There was a change from moaning and discomfort on the first visit to normalcy, which I thought was striking. The first time I get it, there was something wrong with it. That's why we requested records. The second time, it was complete opposite behaviors. Wheelchair bound, on a laptop, very happy, very distracted with whatever she was doing at the time. And I remember specifically, this is where it hit me, when I talked about how the workup that I had done did not prove immunodeficiency, and I wasn't aware of I could explain everything else going on, and then she went into this phase of crying, and my ear hurt, and I have a headache. So after that was over, and I tried to find out what was wrong with her, and I tried to ask Mom, "Are you okay?" Then when the visit was over, as she's wheeled out to the waiting area, everything normal again. So you asked me about that narrow comment you made. I'm looking at a whole picture that led me to believe there's something not right about this. That's all.
Well, tell me then what the primary symptom then is under DSM-5. Strike it. Do you have any information whatsoever that Beata Kowalski falsified any fact?
I'm sorry. Okay, let me reframe that question. So you're asking me if I'm aware that Mrs. Kowalski lied about...
Doctor, what I'm asking you is whether you have any direct evidence that Beata Kowalski, based on your 2 visits with her, falsified to you any fact.
No, sir.
And can you remember whether the first element of Munchausen by proxy leads off with falsification of physical or psychological signs?
Objection,
Do you
Your Honor.
remember that off?
For use of an authoritative source.
Would,
I'm going to sustain that one.
would it refresh your recollection to show you the DSM-5 in that regard?
So you're giving me one of
Objection,
4.
Your Honor.
So just to...
Why don't, hold on, before you answer, why don't you all approach?
recognize the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, as authoritative on Munchausen by proxy, now known as factitious disorder imposed on another.
I believe that the term utilized now is known as medical child abuse, and it's not fictitious. So I believe the more recent diagnosis is different. But I'm not familiar with the manual as it is outside of the scope of my practice.
So you, all right. So whether I showed this to you or not, you wouldn't know what the elements were.
You can tell me what the elements are, but it's beyond the scope. All I can tell you is we are trained, if we see anything that we may perceive as harmful to a child, that we have an obligation to pass out that information to someone. And my first person was to the primary care physician, who knows that patient more than anyone else.
Would you like to see, would it refresh your recollection to see the very first words on the diagnosis of a factitious disorder imposed on another?
Objection to proper foundation.
I do not feel that just looking at one item of 4 is going to help us change our gut instinct of us feeling that you may have in a child in your office that you feel might have been in danger. And I'm being honest.
Mr. Hunter? Members of the jury, any questions? Okay, given the number of notes being submitted, once all the notes are collected, I'm going to ask you to go back to the room. Do not discuss this case amongst yourselves. Do not do any investigation and receive no information.
All rise. Jurors exiting.
Jury's out of our presence. Dr. Mendes, I need you to step outside. Let's get Dr. Mendes as well while we're working at it.
All rise. Jurors entering.
Okay, please be seated. Members of the jury, I want to confirm while you're away, you did not discuss this case amongst yourselves. You did no investigation, received no information. Is that all correct? Correct. And none of you saw any media accounts about this case since you were last with us? And no one approached you, is that correct? Correct. And just to remind you, I did discuss these questions with the lawyers outside the presence of the witness. Doctor, the jury has several questions for you. Did the doctors at All Children's Hospital think that Maya had asthma and treat her with it?
Are we referring to the pulmonologist, Dr. Kreisman?
Do the best you can to answer the question.
So I don't have records from All Children's Hospital. I want to be clear. The only records I received was from Dr. Kreisman from the visit after she was discharged from the hospital. And then the question is, do I have evidence that she had asthma?
And did the doctors at Johns Hopkins All Children's Hospital think that Maya had asthma and treat her with it?
So based on the records, there's a normal spirometry, meaning breathing, the pulmonary function test was normal, but he had advised to continue on a inhaler that was prescribed in a course of tapering corticosteroids.
Before you saw Maya, did you know what CRPS was and how it affects people?
It's a great question. To some degree, I have a lot of veterans in my practice. I see adults and pediatrics. That's the treating we have. It's not just pediatrics. So we would have folks that come in with some complex pains that I would hear from the VA notes of the possibility that they may have CRPS. But I wasn't familiar with the disease. I just know they complain about kind of phantom pains and burning sensation on skin. That's my only recollection of that disease.
Did you notice any signs or lab numbers that showed Maya was getting ketamine treatments?
That's a great question. So let me try to explain So I wasn't aware she was receiving ketamine treatments until the second visit. Was there anything that I would expect? I have no idea. I'm not familiar with ketamine treatments in the U.S. to begin with. I was surprised that she had gone to Mexico to have that done. So my short answer is no. I'm not aware of any abnormal labs that might be linked to some treatment she received outside of the country.
Did you ask or know why Maya was in a wheelchair?
Yes, sir. We did on the first visit, and she did tell me that there was pain and spasms, is what she was describing. She did mention she mentioned the word RDS when we first met. However, I wasn't familiar with the disease. I had an idea of what it might be, but I clearly said it's outside of my scope, and I think I alluded to that in my notes. Have follow up with primary care or neurology for these because I don't know how to manage those.
The next question. I see you had concern of possible Munchausen syndrome by proxy enough to document in Maya's medical record. As a mandatory reporter in the state of Florida, did you call and report this to CPS?
That's a great question, and the reason I didn't do so, and I apologize if I didn't allude to this in the past. You can have hunch instincts of things. I'm the one guy who's seen this person twice in my office with an extensive medical history, and I reached out to the one person who would know from any other specialist that has seen this child will have an idea of what's going on with her. I'm just, like I said, one small part of her life in that less than a year that she was having these symptoms. So my reach out was not to the state, sir. It was actually reaching out to the primary doc. Listen, is this something that you've considered? That was all. I don't want to report something like this where I'm not 100% certain that that's what's going on. It was a red flag, basically, is what I'm sending out there.
Well, he already answered the why not question, so we'll move on to the next one. Doctor, you mentioned your training and specialties. In any of those specialties, was CRPS, or the older term that it is known as, was this CRPS part of those specialties?
Good question, and the answer is no. Understand, we're referring to the allergy immunology, we're referring to both allergy and pediatrics. I'm not sure, but let's assume we're looking at both. The short answer would be no. RDS, to be quite honest with you, at my time of training, probably was just like fibromyalgia, other diseases where we think there's something there, but we don't have evidence of substantiate or objective ways of treating it. So my short answer is no, we do not.
And this next question is similar to another juror's questions. Upon your first meeting with Maya in October 2015, Maya was in a wheelchair. Do you recall what was Maya or Beata's explanation for the need of a wheelchair?
Well, similar to what I said earlier, I wasn't given a diagnosis until towards the end, where she mentioned RDS. But she was doing we do a review of systems, so we kind of go over each organ and ask questions. And that came up as part of her neurological, that she does have spasms and pains. And also, I think she mentioned headaches. And she corrected me and said that headaches are part of RDS.
During the December visit, was Maya in a wheelchair on that visit?
Yes, she was. Unlike the previous visit, she was in no pain or distress. She was on an iPad. I remember it clearly because I thought it was pretty neat that she was actually doing a Word document. So I don't know if she was writing the story or something. It just struck me as a young kid doing that. That was pretty neat.
On this December visit, was were any pain issues mentioned like the visit's initial daily interview?
I'm sorry, can you repeat that question?
Yeah, let me just read it verbatim. On this December visit, was any pain issues mentioned as possibly the visit's initial daily interview?
No, it was not. That did not come up. The purpose of the second visit, as it always usually is to follow up on anything that I do and to review the records. And she did bring additional records to that visit, but it was not mentioned at all. She did go into, like I said, some sort of a spasm towards the end of the visit when I was giving her a summary of my findings, and I thought that was kind of odd.
When you said spasm, you mean Maya or Mrs.
I'm sorry,
Skolsky?
Maya did, yeah.
During the December visit, did you see any signs of dystonia?
No. So so assuming we're referring to dystonia as muscle cramping or some changes associated with muscle cramping, usually the lower legs are the more common. I'm assuming that's what we're referring to. I did not. There was a physical examination done on both visits, and both visits did not correlate with any. Again, from the best of my abilities, I don't do a full neurological exam. I'm not a neurologist, but I did not see any joint aches and pains when I examined her. I did not see from visible skin lesions at all. So my short answer is I did not.
Was Maya in long or short pants?
Ooh, that's a great question. I'm trying to remember. I remember I was able to see her ankles. That's all I can tell you, and I believe she may have had not long or short pants. What do they call them? Capris? So short, yeah. That's what I remember. It's 8 years ago. I'm sorry, guys.
Was she wearing socks, shoes, sandals, flip-flops?
Do not recall that part, no. And I don't believe she was wearing footwear, but I just don't remember the top of my head.
Next question. And this was prefaced as a yes or no from the juror. You mentioned that based on your examination of Maya and reviewing of testing results, you came to believe Maya suffered from Munchausen syndrome by proxy or similar term?
And you're asking for a yes and no
Well,
answer?
you can expound, but why don't you first start off with yes or no?
It cannot be a yes and no answer. I can only say suspect, and I'm required to raise a red flag somewhere. I have to reach out for somebody to help.
How many cases of Munchausen by proxy had you encountered up until 2015?
This is probably my second in my career, so that would be 2.
That completes the asking of the juror questions. Mr. Hunter, do you have anything in follow-up? Mr. Anderson, do you have anything in follow-up?
So you defer to Dr. Wassenauer on as to whether there really was Munchausen by proxy or not. True.
In my letter, yes, sir.
Thank you.
Any follow-up to that? Members of the jury, any further follow-up? Okay, may this document be released?
Yes, by plan.
Yes, sir, Your Honor.
Sir, thank you very much. Defense, your next witness, please.
We call Dr. Jennifer Katzenstein.
And raise your right hand.
Do you solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, nothing but the truth?
I do.
Well, come this way.
Good morning.
Good morning.
If you could introduce yourself to the jury, please.
My name is Jennifer Katzenstein.
Okay. And what's your profession?
I'm a pediatric neuropsychologist.
Okay. So let's talk a little bit about what the road to becoming a pediatric neuropsychologist.
I'm sorry to interrupt, but I haven't heard the question.
Yeah, so you might need to
Get closer.
Yeah, sit a little closer to the microphone, pull it near you. There you go. Start at
Thank you.
basics. Let's see if everyone can hear you. Introduce yourself to the jury.
My name is Jennifer Katzenstein.
I think that's going to work.
Better? Okay.
A pediatric neuropsychologist, where did you go to undergrad?
I went to undergraduate school at Lafayette College.
Okay. And what did you graduate with?
Bachelor's of Science in Neuroscience.
And then after you graduated with your Bachelor of Science in Neuroscience, where did you go to school next?
I went to graduate school for my master's and my doctorate degree at Purdue's campus in Indianapolis.
Okay. And did you achieve your doctorate?
I did.
Not to age you, but I got to ask, what year did you graduate?
2008.
Okay. And after you graduated, where did you go next?
I went to fellowship, which is a 2-year placement at Texas Children's Hospital in Houston, Texas.
Okay. Maybe you could look to the jury and explain to them what is a fellowship training? What does that entail?
So for psychology, it's similar to physicians. We spend 1 year as an intern at a placement somewhere across the country in order to get your degree. And then after that, you have to have a number of supervised hours to be able to be considered license eligible across the country. And so for me and for pediatric neuropsychology, we're required to have a 2-year placement in order to be board eligible. So that was my 2 years of training after my degree was completed.
Did you achieve board certification?
I've achieved board certification by the American Board of Professional Psychology in both clinical neuropsychology and subspecialty in pediatric neuropsychology.
And do you retain those board certifications today?
I do.
Okay. What's your focus?
My focus as a pediatric neuropsychologist is on how the brain impacts behavior and cognitive functioning, and how we can best support children in determining their educational and vocational needs based upon their cognitive strengths and weaknesses.
Okay. So, how long have you been working at All Children's Hospital?
I've been working at All Children's for just over 8 years.
Okay. So if we work backwards, do you remember when you started, what year?
July 2015.
Great. All your work is in pediatrics?
All of my work has been in pediatrics.
Are you familiar in general with the diagnosis of pain as a component of pediatric disorders?
I am.
What percentage of your practice is devoted to working with children who have pain?
That's challenging to say because kids have varying levels of pain throughout multiple different types of medical treatments. So I would say many of my patients have some level of pain as it relates to their medical history or their current medical treatments.
Okay. So we're going to talk about what your role is, but I'm going to try to let the jury understand from you what your role would not be. You're not a medical doctor that makes a medical diagnosis. Is that fair?
I'm not a medical doctor.
Okay, so I think one of the things the jury might want to know, are you going to be telling this jury whether Maya has or does not have CRPS?
I will not be speaking, confirming, or denying any medical diagnosis.
Okay. So let's talk a little bit about pain scores, because the jury's heard a little bit about pain scores. How do you take a pain score from a child?
So with kids, it's more complicated because pain is subjective and pain is very specific to the individual. So for kids, and for many people, we have a scale of 1 to 10. For kids, it has little faces next to it as well, where we say a 1 would be no pain and a 10 would be the most pain you've ever felt, and ask them to give a rating or point to the smiley face along that pain scale.
Okay. So is it subjective?
It is subjective.
Okay. What do you normally see in a child who's reporting 10 out of 10 pain?
In a child who would be experiencing a 10 out of 10 pain, that should be the most significant pain they've ever had. And so that would be, from my observation, something like lying on their bed, maybe curled up, not willing to speak, maybe feeling nauseous, vomiting, not even being able to speak, maybe even screaming because of the pain that they're experiencing being so severe.
You've had a chance to evaluate children who deal with chronic pain?
I have had some children with chronic pain in my practice.
Do children with chronic pain generally report higher or lower scores of their pain?
It really depends. Our pain is specific to who we are and also our perception of that pain. And so when maybe someone says, I have a really high pain tolerance, they might rate their pain a little bit lower because their worst, most significant pain or their perception of that is higher than maybe someone who doesn't have that same perception of pain or understanding of their own pain.
So I'm going to ask you about some of your interactions with Maya and her family. Okay. We're going to start, Clay, with Joint Exhibit 1001-3748, which is in evidence. If you could put that up, please. And we can probably focus in where your psychology consult note begins. Just sort of talking about this note, if you can tell the jury, what was your purpose of trying to meet with Maya on this day?
Yeah. This would have been the day that the consult would have been received by the psychology service to complete this request by our medical team. In this initial note, I'm looking here, I was meeting with the pain team to discuss the plan of care, and I introduced myself to the family. Oftentimes in these situations, there's numerous providers in and out of the room, so we were working to schedule a time so that we could speak all together.
And just so the jury's aware, is most of your practice on the campus inside the hospital, or is it off campus?
For my practice, primarily, I'm an outpatient provider, meaning that I do clinics that are in a separate building from the hospital. However, at this time, we had 3 psychologists, and we each rotated on call every week. And so when those times came up and a consult was received and I was on call, I would be inpatient for those required appointments, consultations, needs for my patients, and also outpatient during my clinic time as well.
Okay. So during this first time that you had spent with the Kowalskis on 1010, did they ever express to you a desire to leave All Children's?
No.
Okay. Let me talk to you about your next note. It's on Joint Exhibit 1001-332. Sorry, yes, it's 1001-3832. And if you could pull out where her note begins, this would be the next day, October 11th, is that correct?
Correct.
There's a statement in here about the interview history, about why you were being consulted. Can you tell the jury why you were being consulted on this day?
Initially, my understanding of the consultation was that Nemours wanted to have a measure of cognitive functioning, or IQ, completed as part of the transfer request. But as I became involved and met with the medical team, that had evolved over time to supporting the family during the hospitalization.
Okay, so we'll talk about your role in terms of supporting the family and supporting Maya going forward, but there's a discussion of Nemours. Did you have some familiarity yourself in terms of what Nemours could provide?
I did. About 6 months prior to this, myself and another anesthesiologist had traveled to Nemours to observe the program. We were interested in putting together a business plan to do something similarly, and spent the day with the team at Nemours observing their physical therapist, occupational therapist, their psychological therapist, and then also working with their physician to get an overview of the components of the program and then how the day was set up for each patient involved.
In your note, on the second sentence, it says, this has evolved to provide supports for the family and discuss the importance of cognitive behavioral therapy and pain management. Do you see that?
Correct.
Can you explain to the jury, what is cognitive behavioral therapy?
Cognitive behavioral therapy is a therapy that we use as psychologists and therapists. It's evidence-based. It actually has quite a bit of support behind it as the standard of care for many psychological conditions, and can help with the stress and anxiety related to medical conditions as well. But what it is we look at how our thoughts impact our feelings and our behaviors. And so we talk through different coping strategies, an understanding of the interplay between our stress, our anxiety, our mood, and those thoughts, and then work to address the thoughts to in turn improve our mood, our feelings, our behavior.
From your perspective as a neuropsychologist working with Maya to provide cognitive behavioral therapy, does it matter the source, meaning whether it's psychogenic pain or an underlying illness?
Interestingly, for many conditions, psychological and otherwise, cognitive behavioral therapy is a strong therapeutic technique regardless of diagnosis.
Okay. Let me turn to the next page, Clay, it's 3833. And this is page 2 of your note, and I'll direct your attention to the top. Do you recall, or does this help refresh you, that you had met with Maya and her father the previous day?
Mm-hmm.
So you're coming back the next day. What is the goal? What are you trying to get?
My goal was to meet with everyone together.
Okay. And does your note reflect whether you were able to eat with Mom, Dad, and Maya all together on this day?
I was not yet able to meet with everyone together.
Okay. It looks like you tried to call Mom to arrange it, and for whatever reason, she just wasn't available at that time.
Correct.
Okay. So we're going to direct your attention now to the next note, the next day, which is Joint Exhibit 3829. And this is now the third day. And just backing up, and I'll cover this for each day, on October 11th, for any interactions they had with the family, did anyone express a desire to leave all children's?
No.
Okay, so let's talk about 10-12s. The next day, this is your third attempt to meet with all the Kowalskis, is that right?
Yes.
Okay, so let's go to the next page, which is 3830 at the top. And again, it looks like the second paragraph, you were trying to meet with Maya's mom again, is that right?
Correct.
And for whatever reason, she was unavailable to meet with you at this time?
Correct.
Okay. And then you discussed, well, take a look at your note. Did you discuss with the nurse some techniques that she could employ with Maya to help her?
Yes.
And what would those techniques be?
I spoke with the nurse about different ways that she can help Maya calm down, including utilizing deep breathing, some meditation, so again, that calming process for our body. And then sometimes for our kids in the hospital, there's a lot of people in and out of the room. And to give them some control of who comes in and out, we put a stop sign on the door so that maybe for 20 or 30 minutes each day they can say, I don't really want anyone in the room. I don't want to be bothered during this time, because there's so much happening medically. Then that way they can put that stop sign out there and really control who's in and out.
It looks like, according to your note, you called mom to meet with you?
I did.
Okay, and at least as of this time, you didn't receive a call back. Is that fair?
Correct.
And Clay, just because we've covered this, but if you can scroll down a little bit on this page where it says medical history, we'll stop there. There's a number of diagnoses here with the medical confirmed. Can you tell this jury how that gets on your note?
Yes, those are entered by the medical team, and when we write notes in the electronic medical record, oftentimes there are pieces of the medical record that automatically come in. And so those pieces of the note are brought in by the different software program and then are not made by me, but are presented by the medical team.
And I think we talked about this at the start of your testimony, but whether these diagnoses exist or do not exist, that's not something that you get involved in. Is that fair?
Correct.
Okay. So let's talk about the next day. You made it looks like another attempt, which is the fourth attempt to have a family meeting, and that's at 1001-3824, please. And we can expand it a little bit there. Okay. Did you have a chance to meet with the family on this day?
I did.
Okay. All of the Kowalskis?
Correct. Well, my mother and father.
I apologize, right. So it was mom, dad, and mine.
Correct.
Okay. It looks like, at least according to your note, you spent a significant amount of time in conversation?
I did.
Okay. At any point during this meeting on October 13th, did anyone express, and did either Jack or Beata Kowalski express to you a desire that they wanted to leave the hospital?
No.
Objection, straw man.
And it looks like you had a long conversation of some of Maya's medical history. Do you see that? In terms of the homebound and
Oh, yes, just scroll a little bit further.
okay. We'll flip to the next page, Clay, which is 3825, please. And take a minute to review your note if that helps you refresh. I'll ask you a couple of questions about this.
Okay.
You have a comment about halfway down the first paragraph where it says that the school transition caused significant anxiety and exacerbation of her pain. Do you see that?
Yes.
And then the next sentence says her parents reported understanding that anxiety and stress are directly related to her pain.
Yes.
Can you explain from your perspective as a neuropsychologist what the interplay is of that mind-body connection with pain?
Absolutely. So when we have increased anxiety, stress, or other psychological functions, we can see an increase in other physical symptoms as well. And in this case, Maya's parents understood in our discussions that having increased stress and anxiety about having to return to school was related to an increase in pain.
The return to school, did you have an understanding as a neuropsychologist what that meant in terms of how many hours Maya would be receiving at home versus now what she was being asked by the school board to come back to?
Yeah. So in my experience, hospital homebound services means that the teacher comes into the home pre-COVID in person for 2, 3, maybe 5 hours in total per week. And then there's other assignments that the student is doing throughout the week. So going from hospital homebound with a few hours per week of individual teaching supports back into a full school academic setting, I understood could be stressful because that's a big transition.
Okay. In the next paragraph, where it starts with her parents went on to describe the stress, there's a comment at the end of it about mom directing you to a blog and a fundraiser. Mm-hmm. Do you see that?
I do.
Did you have a conversation with Mrs. Kowalski about whether you should be reviewing the blogs and the fundraising pages?
I recall her offering those to me to provide a better understanding of Maya's condition. However, I indicated that I don't utilize the internet or social media or any other sources for my families because I want to gain that information directly from them.
In the next paragraph, you were discussing your observations with the Nemours Pain Clinic.
Yes.
And I know you gave the jury some understanding of what you knew about it. Would it have been your recollection that you would have recommended to the Kowalskis this being a program that they should consider?
Yes, I continued to recommend that, the duration of the hospitalization.
Okay. Let me direct your attention to the next page, which is 3826. Under the histories, it says history limited by. Can you read that for a moment, Doctor? What did you mean by altered mental status and Maya's pain and emotional status?
So as a part of every consultation, we do a mental status. so I can report back the current functioning of that individual child. And at this initial consult, where all family members, mom and dad, were present, Maya appeared to have an altered mental status, as she wasn't able to report or discuss with me at that time, and mom and dad were providing all of the responses.
Okay. And having met Maya prior, when it was just her and her dad, and now meeting Maya when her mom's present, was there a difference in Maya's affect?
In previous meetings, I had spoken with her, and she had been conversational, and she was not at this meeting.
Let me turn you to 2 pages deeper. It's at 3828. Under the appearance section, what did you note?
I wrote here, Maya was poorly groomed, and her parents reported this to be a change in her demeanor, as she usually takes great pride in self-care.
And then under the social emotional, what did you report?
Anxiety, depression. Maya's parents report significant anxiety and stress exacerbate Maya's pain. In addition, they discuss that she appears more depressed, and that her mood has changed because of her pain.
Clay, if you'll scroll down to the assessment and plan to the bottom where there's a diagnosis. What was your diagnosis as of this day after having the family meeting?
At initial meeting, I diagnosed psychological factors affecting other medical conditions severe.
What does that mean? Can you explain that to the jury?
Per the medical record, there were medical diagnoses, and in discussions with parents, they noted that anxiety and stress exacerbate the pain that is related at that time to the medical condition. Severe means hospitalization. So there's different levels, and per our diagnostic and statistical manual that we utilize to diagnose, severe equates directly to hospitalization.
The next line, you have something that says rule out somatic symptom disorder. Can you tell the jury what your thought process was here?
Yeah. Pain disorders, psychological components of pain are complicated, and so in this section of our manual, there are multiple different diagnoses. Somatic symptom disorder is one of them, and what it means is that the physical manifestation or the symptoms related to the medical condition are out of proportion with what the individual is perceiving. And so it might be excessive focus on the symptoms. It may be that the symptoms and the condition become part of one's identity, and that treatment has really taken over their life and become who they are. And I wanted to explore that further as we continued our time together.
The jury's heard at various times a diagnosis called conversion disorder. Are you familiar with what that is?
I am.
Can you explain to the jury what conversion disorder is?
Sure. So also in this chapter is conversion disorder. That's when one or more physical symptoms can't be related to a physical or medical condition. And so it's thought that maybe anxiety, stress, psychological factors are manifesting a physical symptom, and it's not purposeful. This is really a complex interplay of how our mind and our body work, and sometimes related to that, you can see that a patient has a reinforcement for those physical symptoms. And again, our minds are creating these physical symptoms, even though that patient isn't purposefully creating them.
Yeah, and you bring up a good point, doctor. In conversion disorder, that doesn't necessarily mean the patient is faking it. Is that true?
Correct.
Sustained.
Does conversion disorder in your training mean that the patient is faking it?
In conversion disorder, many times the symptoms are real. What's happening is real. It is very much not being rooted in a medical condition, but that, or faking it, or pretending. These are real symptoms that are happening.
Can you explain to the jury or expound on the concept? You talked about the subconscious level of this. Mm-hmm. What is the interplay of conversion disorder and the subconscious of a patient?
Yeah. Conversion disorder really is in the subconscious. So these symptoms are coming through as a result of significant stressors, psychological or emotional factors. So it is, again, that deeper interplay in our mind where the physical symptoms arise.
Let me direct your attention to 3829, which is the last page of your note, and just if you could go to the top, Clay. You made some recommendations. What did you recommend to the family at the end of this family meeting?
Yep. I would remain available to the patient during the admission, and I'll continue to follow Maya during the admission. And then I was requesting continued follow-up with her outpatient psychotherapy provider utilizing evidence-based practices, including biofeedback and cognitive behavioral therapy, and then follow up with Nemours Day Treatment Pain Program.
What was Nemours asking you to do or someone to do on Maya's behalf before transfer?
My understanding for the reason for my consultation was to get a measure of IQ, of cognitive functioning.
Was that task performed by you or Dr. Lewis, or what ultimately happened with that?
Ultimately, that was completed by Dr. Lewis.
Okay. Can you tell the jury why you didn't independently repeat that?
Yeah. So when we utilize measures of IQ, per the standardization of those IQ measures, you can't repeat them within a year. And Dr. Lewis, at that point, was involved in the case. He would be doing an evaluation, and so it wouldn't be within the bounds of each intellectual ability measure to be able to repeat that within a year, let alone a few weeks.
Let me ask you about the next time you saw Maya. We'll go to 3821. And just to orient you, at this point, the shelter order had been in place. Is that right?
And 1014.
Just so we're not getting, I'll represent to you that after this meeting, as of 1014, that there was a shelter order.
Thank you.
Okay. Were you attempting to see Maya the next day to continue cognitive behavioral therapy?
On 1014, I attempted to see her. She was not available, and I'd follow up on Monday.
Okay. So your plan after the 1013 meeting was to continue to see her for cognitive behavioral therapy, but she was in a procedure or something where you can... Okay.
Correct.
Plan was to come back Monday?
Correct.
Got it. Okay, so let's talk about the next time you saw her, which would be 3816. And you can just note the date of the time, and I'll just direct you to the page 3820. If you can go to 3820. And you were able to perform cognitive behavioral therapy with Maya on this day?
Yes, on the 17th.
What did you notice about her appearance at this point?
She was appropriately dressed and groomed.
And what did you notice about her orientation?
She was oriented to person, place, time, and situation.
I'm going to direct your attention next to 3813. And I'll note it's at the bottom, Clay. It shows that you attempted to meet with Maya again 2 days later on the 19th. What was the purpose of this meeting?
To continue to consult and provide support.
Okay. And would that also include cognitive behavioral therapy?
Yes.
Let's go to 3814, please, the next page. And if you could focus on the interval history.
Mm-hmm.
And were you able to provide cognitive therapy on this day?
I was not. Maya was not in her room.
And what was your plan?
I would plan to follow up the next day, continue to provide CBT and some guided journaling.
Okay. Let's go to 3810, which is your note from the next day, 1020. And I'll just note that the date of the note. Let's go to the next page, which is 3811. Were you able to meet with Maya this day to provide cognitive behavioral therapy?
She was not in her room.
Okay. And what was your plan?
I would plan to follow up the same day if I had time, or the next day, and continue to provide CBT and guided journaling.
Okay. So let's go to the next day, which is at 3807. Now we're on October 21st. Were you able to connect with Maya on this day?
I was.
Okay. Take a look at your notes. Is this the what are you doing for this section of cognitive behavioral therapy?
Initially, in cognitive behavioral therapy, we start with what's called psychoeducation. So education and information surrounding how symptoms of pain interact with our moods, our emotional functioning, our stress and anxiety. And we started to discuss the role that our thoughts play in physical outcomes, especially tensing up prior to physical therapy as she worries it will be painful.
In the next paragraph, you have this comment about her pain in the second sentence about her pain being expressed to be a 10,
Mm-hmm.
But you have a comment about her affect. Can you describe to the jury what you meant by this?
Yeah. Her affect was quite bright and didn't match what I would perceive a 10 to be, which would be that significant extreme pain.
You were able to complete cognitive behavioral therapy sessions with Maya on this day?
I was.
So let's go to the next note, which would be on October 26th, and Clay, that will be at 3803. Would this be the fourth session of cognitive behavioral therapy you were able to perform with Maya?
Yes.
And was she present to be able to participate?
Yes.
You have a comment here about, in the second paragraph, about scary movies and our time in Mexico. Can you describe to the jury what that conversation was?
Yeah, and part of our guided entry into her journal, we were talking about different questions. So a guided journal entry would be a question that we were answering together. And so we were completing an entry together of what she was most afraid of. And she indicated that when she was in Mexico receiving treatments, she saw a scary movie, The Ring, and that she was very afraid of that movie.
I'm going to take you to the end of your note at 3806. And you have some recommendations here, Doctor.
I would continue to follow Maya while she was inpatient and provide CBT. And then as discharge was considered, it was highly recommended that she be placed in an inpatient pain program where she can receive frequent cognitive behavioral therapy and biofeedback from a psychologist.
It looks like you attempted to meet with Maya next for cognitive behavioral therapy on October 31st, Halloween. I'll take you to your note at 3799. And if you just look at the interval history, can you tell the jury whether you were able to do cognitive behavioral therapy on this day?
I was not. Her father was present for a supervised visit.
Okay. And what was your thought process?
Yeah, I wanted to honor their time together and allow them that time to be together, and I could come back the next day or another day.
Okay. So let me direct your attention to your note of 11/2, 2 days later, which is at 3795. Were you able to spend time with Maya on this day? Well, actually, let me direct your attention to the second page of the note. And at the top, in terms of interval history, you document a conversation with a social worker.
Mm-hmm.
How does that work at All Children's in terms of the liaison of DCF and social work?
Yeah, our social work team is the primary liaison between DCF and our hospital staff.
Did you make any recommendations to Kathy Betty of social work in terms of what Maya might need after discharge?
So oftentimes when there's a shelter of a patient, they're ready for discharge from the hospital far before the court has made a decision about what the next steps look like or where the child can go if they can go back to the home. So what we do is we provide recommendations for what those next steps should look like should they not be able to be reunified with their family. So in this case, what I was recommending was first going into some type of rehabilitation or pain management program, and then if the decision still had not been finalized by the court at that point, she would be going into a foster care setting, and there's different levels of foster care setting, and I want it to be the most appropriate level for her needs. So in this case, it was the medical foster care with the mental health component so that they could understand her medical appointments, any potential medications, and the complexities of what was happening.
Let me direct your attention to the next note, which is at 3791. Did you attempt to meet with Maya on this day, 2 days later, for cognitive behavioral therapy? Clay, you can go to the next page at 3792.
So again, her father was present for a supervised visit.
Okay. And did you, again, just to move things along, you decided to honor their visitation time and come back another day?
Correct.
Let's turn to your next note at 11/8, which Clay will be at 3787. And were you able to provide, well, we'll do it at 3788, which is the page of your note. Were you able to provide some cognitive behavioral therapy with Maya in this case?
Yes.
And were you able to, would this be cognitive behavioral session number 5?
This would be number 5, correct.
So let's go to the next note. The next day on 11/9, did you attempt to meet with Maya for cognitive behavioral therapy? Clay, it's at 3783.
Yes, I did.
And let's go to the next page, which is 3784. Per your note, were you able to provide cognitive behavioral therapy session number 6?
Yes, on 11/9.
And what types of things are you discussing during the session?
She's discussing wanting to go home. She was up all night worrying and crying about the outcome of the court hearing, and she described her pain to be a 10.
Let's talk about the next note, which is at 3780. We'll go to the second page of this. This isn't a cognitive behavioral therapy note, but it discusses some interaction that you had with risk management with Kowalski's. Is that right?
Yes.
Okay. Do you recall what the circumstance of this was?
Yes.
Okay. Why don't you tell the jury what the circumstances were at this point?
We had received a court order from the court to provide family therapy. I am not a family therapist, and on staff, none of our psychologists were family therapists. I wanted to provide the information to risk management of how to proceed, given that we did not have a psychologist on staff with family therapy experience to be able to complete this request.
And it looks like in the second paragraph you provided your cell phone number to Mr. Kowalski.
He provided his cell phone number to me. I subsequently provided the direct line to my office.
Okay. So you provided Mr. Kowalski a number that if he wanted to talk to you and contact you, he could reach out to you directly.
Yes.
Objection here. Leading.
Overruled.
Let's talk about the next time that you saw Maya, which would be at note 3776. Were you able to connect with Maya for cognitive behavioral therapy on November 25th?
Yes.
Okay. And at least on the first page of the note, would this be cognitive behavioral therapy number 7?
Yes.
Okay. And again, you're reinforcing the types of activities that you would recommend for these sessions?
Correct.
Let's talk about the next attempt. Would that be on December 2nd at note 3773?
12/2, I attempted to see her.
Okay, let's go to the next page. What happened? Where was Maya?
She wasn't in her room.
Okay, where are, I don't know if you remember specifically, but for a patient like Maya, where would she be?
Yeah, there could be a couple places for physical therapy and occupational therapy. We have a gym where the kids can go to, so they're doing more activities and there's more place to be.
Objection, speculation.
Overruled.
Or in the activity center, we have an additional place where our patients go, that Child Life staffs, where different activities are happening.
Let's go to the next attempt to meet with Maya for cognitive behavioral therapy, which would be at note 3769. And it looks like she, again, was, at least per your note, in physical therapy and not available. Is that right?
Yes.
Let's go to the next attempt to meet Maya, which would have been on December 14th at note 3766. And did you attempt to provide cognitive behavioral therapy again on this date?
On this day, yes, her nurse let me know that she was in the activity center, so I went down to the activity center, but she was working on a group activity with other kids and wasn't interested in speaking to me.
Okay. Do you remember what the activity was?
I do not.
Let's go to the next time you tried to meet with Maya for cognitive behavioral therapy 2 days later, and that would be at note 3763. Do you remember where Maya was?
She was not in her room. I do not know.
You note that you had a plan to discuss rewards for goals. What is that, doctor, if you could explain that to the jury?
The physical therapists were looking for ways to help engage her in physical therapy, and so oftentimes we put together a behavior chart, and we set goals. We want them to be small and achievable to start, and then those are linked to rewards. So At home, it could be things like choosing what the family has for dinner, extra time before bedtime. In the hospital setting, we're looking for what things can be reinforcers to help her to engage and feel motivated to engage in those physical therapy activities.
Let's talk about the next time you visited with Maya, which would be 4 days later at note 3758. Were you able to connect with Maya on December 20th?
Yes.
Okay, let's go to the next page. And just to speed things along, it looks like you're summarizing the rewards plan. Is that right?
That's correct.
How did she react when you discussed this potential rewards chart?
Yeah. At first, when I walked into the room, she appeared frustrated and down. But once I mentioned we'd be discussing rewards, she quickly brightened and was cooperative, outlining the list that you see here.
So talk to me about this list on potential rewards. Clay, you can scroll down a little bit. How does this list work?
So it's an opportunity for a patient or child to tell us anything that might be motivating for them. And then we take it back to the team, our child life specialists, to determine what could be feasible. Could we have someone come in and do hair and makeup or manicure or pedicure? Or could we figure out a way to do an individual tour of the helipad or have her play the piano in the lobby? What can we do? What can work?
What is a child life specialist?
A child life specialist is someone trained in normalizing the hospital experience for our patients. They're there to provide activities, talk through medical procedures, and provide support to the patient and their family.
And did all children's have people that could come into the hospital and help fulfill some of these rewards or requests of the child?
Yes. Pre-COVID, all of these things were on the table.
So let's talk a little bit about the next time you saw Maya, which would be 2 days later, 12/22/16, if we could go to note 3755. Looks like you, in the note, she gave you some more ideas for rewards. Is that right?
She did.
Well, I don't know what gelato from Pasiugo is. What is it?
I'm sorry you don't know that.
What am I missing out on?
It's a gelato place that is in St. Pete and multiple places that has multiple different delicious gelatos.
Okay. And do you have a recollection of whether the hospital was able to help with that?
Yeah, I do remember Pasiugo gelato coming into the hospital for Maya.
Okay. Let's talk about the next visit on 1001-3751, please, Clay. This was the 9th cognitive behavioral therapy session that you were able to accomplish with Maya?
Yes.
And you talked to her about coping strategies as she went through her process. Is that fair?
Yes.
Not to dwell on it, but the jury knows that shortly after this, her mom passed.
Yes.
Were you able to meet and provide some bereavement services for Maya?
On the day of Maya's mother's passing, I was present at the hospital to provide support if needed. However, our chaplain went in. I was not asked to go in. And then the next day I followed up with the family and Maya in her room.
Just a couple questions before I yield to Mr. Anderson or Mr. Whitney. Did Maya ever complain to you while in the hospital about any negative interactions with Kathy B?
No.
In fact, did Maya ever complain to you about any concerns she had with mistreatment in the hospital?
No.
Did
Sidebar, please.
Conversation's going to take me a little bit longer than just a couple of moments, so I'm going to ask you to retreat back to the room. Do not discuss this case amongst yourselves. Do not do any investigation and receive no information. We'll see you in a few minutes.
All rise. Jurors exiting.
Okay, the jury is out of our presence. Everyone can be seated. Madam Court Reporter, this is going to be designated as a proffer. Doctor, there's going to be some questions that are asked. We may or may not ask these questions in front of the jury, but for now, Mr. Anderson.
Dr. Katzenstein, in your records, you had put down, you had objects at
1001, 3817.
1001, 3817. There we go, bottom of the page. You put, she denied a history of sexual abuse. Do you see that?
Yes.
She stated that one time previously a doctor had looked at her private parts but did not touch her, and it made her feel uncomfortable. You see that?
Yes.
And then she denied suicidal ideations. Upon receiving a note from this child in the context, and would you agree with me that the context you had set up was a history of sexual abuse? Would you agree that that was the first way, the lead into the next question?
I asked the question of all my patients if they've experienced abuse.
Right. And immediately after that, a 10-year-old girl says, one time previously a doctor looked at her private parts but did not touch her, and it made her feel uncomfortable. You see that?
Yes.
What is repression or suppression of sexual incident in children? What do they do if they have something bad happen to them sexually that they don't understand?
In some cases, when a child has experienced a sexual assault, they may not remember it at that time. In this case, what I saw here, when my discussions with Maya, where she said she had previously at another organization had a doctor look at her private parts, but it was part of a medical examination and that individual did not touch her.
Well, doctor, would you agree with me that a 10-year-old child, or perhaps even younger child, may not know exactly what constitutes sexual assault or sexual battery?
In this situation, a physician looking at the private parts of a patient would be part of a typical medical examination.
And are you aware of the prior proffer of Maya Kowalski in this case?
No.
All right. Well,
I
in a
don't know.
circumstance... Okay.
I don't know what you're speaking of.
Sure. Well, Maya Kowalski, your patient that you were describing here, if it was such that Maya Kowalski actually had a physician come in, a male physician, described specifically by height, weight, what the physician had on, a name tag, everything else, who came through the door and said, and walked up to her without a chaperone saying, "Can I take a peek?" And then went and pulled her drawstrings down below her vagina, pulled her panties down below her vagina, and stared at her vagina for a period of time long enough for the child to feel uncomfortable, and then turn around and left saying, "Thanks." Would that be the type of information that you would find necessary to report?
That was not what was reported to me.
I'm not asking you that, ma'am. I'm asking you if that set of facts came to your attention, would that be something you would have to report?
If there was a hypothetical situation where a patient presented to me a concern where any team member in our organization made them feel uncomfortable, outside of typical medical care, because sometimes medical care is uncomfortable, then I would talk to our risk management team, and if it met the statutes for potential abuse, neglect, abandonment per the Florida statutes for a report to DCF, I would make a report.
Well, you don't necessarily have to have risk management to do that. You are a licensed reporter. You would have to report no matter what risk management said. Isn't that true?
If it met the criteria for abuse, neglect, or abandonment.
In this, you say, Maya told you, she stated, one time previously, a doctor looked at her private parts. She did not say a doctor at another hospital, did she?
She said previously, which meant for me at a different organization.
She had been at Johns Hopkins now for over, what, 10 days? Right. Did you know of any other organizations or hospitals she had been at?
Yes.
All right. How did you distinguish then between all of the doctors that had come and gone in Maya's life from the time she came in on the 7th, or even previously visits at Johns Hopkins from non-Johns Hopkins doctors?
I utilized the word previously in my note because it meant at a previous organization.
And why would it matter where it was if the child's comment there let you know someone stared at her privates and made her feel uncomfortable?
It would be for comprehensiveness of my documentation.
Well, it wouldn't really matter, though, would it? It doesn't matter whether it's a Johns Hopkins doctor or if it's a doctor from down the street or anyone. That's still a reportable offense, is it not?
This is not a reportable offense.
But the point is, you didn't follow up to find out if it was, did you?
This is not a reportable offense. This was part of typical medical care. There was no abuse, neglect, or abandonment.
How could you possibly know what was going on in that child's mind based on just that statement?
I asked her the questions. She told me that she felt uncomfortable and that she was not touched.
And 10-year-olds don't even really know what sexual abuse is in many instances. True?
In many cases, 10-year-olds do know what that is and are openly reporting it.
Yes, but in many cases they do not.
In some cases, I cannot speak to this situation. I wrote down what she reported to me.
Particularly in an instance where a child is being held, let's say, at a hospital, and a lot of doctors come and go in there. That child may not know what's appropriate and what isn't appropriate. Correct?
Each situation would vary. She had been to a number of hospitals and organizations.
If this was not a reportable offense, tell us the specific date, time, and circumstances of this encounter between Maya and a doctor.
I do not know, previous to her hospitalization with us.
You're a licensed reporter, are you not?
Everyone in the state of Florida over the age of 18
You're
is
a
a mandated
pediatric-
reporter.
Sorry, excuse me.
Let me stop you. Can you relay to me your encounter with Maya Kowalski about this incident?
What I have written here is what I recall from that.
Well, did you follow up with questions about the incident, or it's just she made the statement and then you moved on?
Well, this would have been a summary of my discussion with her. So I would have asked, were you touched? Did that physician touch you? No.
So I'm trying to ask you to relay as best as you can remember your discussion with Maya Kowalski that generated this note.
Mm-hmm. So in my discussion with her, I would have asked about potential sexual abuse in the past. Back and forth in our conversation, she declined that happened. She described a situation at a previous organization where a doctor had looked at her private parts during a medical exam and that she was not touched.
And the conclusion that it was a previous organization, is that what Maya said, or is that a conclusion you drew?
I utilized the word previously, which would have been that she told me it happened at another organization.
Okay, so she didn't say it was another organization, she just said previously.
Not here.
Did she say not here?
I have previously, which means to me it meant not at Johns Hopkins All Children's.
You can continue, Mr. Anderson.
Isn't it true that previously that term could mean the day before, or it could have meant the month before?
I would have considered it all to be in the context of the current hospitalization.
I'm not asking you that now. I'm just asking you as a matter of the English language. The term previously could have been from the day before or a month before. True?
Previously means prior to that time.
And prior to that time, for the 10 days before, where had Maya been?
She was at the hospital.
And all the doctors that she saw would be at that hospital, right?
Yes. Well, not necessarily. They may have medical staff privileges, but they may not be employed by the hospital.
The vast majority of
The
them
majority.
would be Johns Hopkins doctors. And yet, with that knowledge, you still did not pursue with this child any further details, did you?
This description that she provided would be similar to what we call a Tanner staging. So a physician for a child between the ages of 8 to 10 would be looking at puberty, they would be looking at pubic hair development, breast bud formation. So my understanding was this was part of a typical medical examination in which a Tanner staging was being completed.
You were aware that Maya had not reached puberty at this point, were you not?
I'm not a medical doctor, I wouldn't be looking into that.
You didn't know, as you talked to this young girl, whether or not she'd reached puberty?
I hadn't asked her about menses.
And isn't it hospital policy? Isn't it, in fact, most hospital policies? Isn't it, in fact, most every doctor's hospital policy that when you go in to see a young female child, if you're a male, you have a nurse or other chaperone?
I can't speak to the policies of all those organizations.
Is that not the policy at Johns Hopkins?
It is not part of my standard practice, and I am not aware of the policy specifically because I do not do that.
You're female. I'm talking about male doctors.
Object to the lack of foundation.
Right? Male doctors going in to see a female, especially a young female patient, especially when there's going to be disrobing involved, have some female proctor or whatever you want to call it, nurse, observer. True?
I can't speak to that. That's not my practice.
Did you see in any of Maya's records a doctor write the term, what was it, Tanner?
Tanner stage?
Tanner stage?
I do not recall. I have not reviewed every single record.
Did you look?
No.
Isn't it true that it could have been just as easily another doctor at that hospital who had come in and disrobed exactly the way Maya Kowalski previously testified?
I utilized the word previously, which meant prior to the current hospitalization.
Based on your opinion of the term?
Based upon what I reported in my note here.
Does the defense wish to have any questions for purposes of proffer?
Yeah, sure. Dr. Katzenstein, we're talking about your use of the word previously. Not what it means generically, is what you're telling this court when you put down the word previously, you meant that specifically to signify that whatever was being described did not happen at All Children's.
Correct. It meant previous to the hospitalization.
And what was described to you, what you wrote that day, was based on your conversation with Maya that day.
Correct.
Nothing in your note is in quotations, is it?
There are no quotes in that note.
Doctor, can I have you step outside for a few minutes?
Sure.
doctors outside of our presence. We're here on the objection to the question having to do with, did she report any abuse while at the hospital or something along those lines?
I think it was more broad than that, Your Honor. I'd have to have the court reporter read it back, but it was just, did anybody tell you anything?
Any complaints?
Any complaints about Maya?
Any prior mistreatment was the phrase.
Okay, whatever it was in follow-up to merely just establishing her interactions with Kathy Betty, the social worker, from her perspective, were fine, and she didn't hear any complaints regarding Maya's treatment. That's all it was meant to do. It's not meant to open this door wide open. And I don't think the jury got any impression about anything related to that. I apologize if this cracked the door on this. I had no idea that this was going to lead to this, but certainly in open court, it's important for the organization to hear from Dr. Katzenstein. I'm sure he was going to proffer her while she was here.
Your Honor, this jury, it takes extraordinary levels of notes. They are on to everything happening here. The jury has now been led by counsel's intentional questions to a conclusion that nothing involving any type of assault, any type of, what was the term again, mistreatment occurred at this hospital when there has been clear evidence in a proffer of something and other evidence in court, evidence of what Kathy Beatty had done. But the problem here is the question wasn't limited to Kathy Beatty. This was an open-ended question in which the witness, and if I'm given a moment, I believe I can find the actual Florida statute, criminal statute, about this behavior as sexual assault. This describes an act of sexual assault if it was even the slightest follow-up to it. And with all due respect to the doctor, the term previously does not give license to all of the conclusions that the witness brought to bear. As a licensed reporter, she was absolutely obligated under these circumstances to explore this and to see what would happen to this little girl, and she did not. Then, capitalizing, I guess, on this, the defense now has this witness testify that nothing of the sort happened, leaving the plaintiffs with the dilemma of how are we going to go and cross on an extremely important point without getting over into an area that so far has been excluded. This puts the plaintiff at a great, great disadvantage in this case, because now it makes it sound like there's an issue of fact here about whether or not Maya was telling the truth on any of it. And so we would move the court to reconsider the whole issue as to the sexual molestation of Maya Kowalski, at least insofar at this point of being able to ask the same questions of this witness before the jury that we ask in proffer, and the court asks in proffer. And I think that is the only fair way to resolve this. I see no way an instruction could clear this up for us. I just don't.
If you need a response, the jury knows nothing about this.
That's the point.
How could a generic question about, did you, whatever it was, see any untoward conduct about Maya, anywhere close to suggesting to the jury about alleged sexual abuse, non-sexual abuse? It was a generic question about just her general observations. It was not meant to drill down and try to prove or disprove something they may bring in a collateral lawsuit. I mean, we're doing our best to toe the line. I didn't show the note. There was nothing intentional about this. There was no emphasis to this question. I just strongly disagree that somehow a question that at best was mildly inadvertent in attempting to capture this somehow poisoned this jury with the impression that Dr. Katzenstein raised her right hand and is attesting that she reviewed the hospital record from A to Z and never saw anything untoward.
Here's where I'm at. I think I asked 2 or 3 questions.
Yeah.
And in that 2 or 3 questions, I was able to deduce that she wrote the word previous. She made an assumption that it was at a previous organization. She didn't ask any follow-ups. And she, being this doctor, didn't, and perhaps in her mind, she just assumed it was this, whatever, the Tanner, whatever. But it didn't sound like she made any sort of follow-up question as it, did this occur here? She just made a conclusion that it was previous. And I got that in 2 or 3 questions. I'm talking now. So, the question you asked was something along the lines of whether Maya had relayed any abuse to Dr. Katzenstein. And I don't think the word abuse, what was the word, Mr. Whitney?
Had she reported any concerns of mistreatment was the term.
So, it seems that the answer no gives the impression to the jury that Maya did not relay any impressions of mistreatment, which probably isn't the correct case, isn't the correct answer. If the assumption is that, or if the assumption is Maya's disclosure was talking about something that was occurring at Johns Hopkins All Children's Hospital in what day did this occur? 10 days after admission?
It was the 12th, I believe. 17th? Sorry, I keep thinking of
So
17th.
now I'm in a pickle because the defense did not want to get into this issue. I excluded this issue, and now you're asking a question that gives the witness the opportunity to give the impression that Maya didn't say anything.
May I call her back and proffer to clarify this? Because,
I asked a couple of questions on that specific issue.
but her testimony is going to be that if Maya had told her that that happened at this hospital, she would have investigated it further. And the reason why she didn't do a further investigation, because it was very clear to her in talking to Maya that what Maya was reporting was something happened at a previous organization. I apologize if that was
We have done the proffer at this point in time. What should I do at this point, folks?
Well, if the question, Judge,
It's Mr. Shapiro.
yeah, I truly believe in my heart there's no way this jury heard that question and thought that there was any implication. I was trying to narrow it to this witness. If it would, I don't want it to happen because it would seem to imply that there's something greater, but I guess the cure to this would be as if Your Honor would tell the jury to disregard the last question and answer, which would be very damaging to the defense.
Well, the jury knows nothing about the alleged sexual assault because I've kept that out.
Right. So,
At your request.
Right, I understand. I guess the cure would be to just tell the jury disregard the last question about I'd have to talk with my defense team. That would seem highly prejudicial, but I guess that would be the cure, but I'd have to talk to it. It's fine. Yeah, okay, then we would.
I'll take 5 minutes. We'll be back in 5 minutes, and hopefully you'll have an idea as to how you want to proceed.
All rise. This court's in recess.
present, so is the doctor. Any further thoughts?
Yes, the question we had the court reporter mark was, did Maya Kowalski communicate to you any concerns of mistreatment in the hospital? Again, I had no intention of implying anything other than the course of action regarding her therapy sessions and what she observed. I did not mean to open the door to this whatsoever. I do not believe anything about that question would bring or allow this court to be derailed into a new cause of action. If the court wants to bring corrective action, they can ask the jury to disregard the last question and answer, which obviously would be some prejudice to the defense, but we would accept that.
Well, the plaintiffs moved the court to, again, we believe the defense should be allowed to finish their questioning, but that the plaintiffs during cross-examination be allowed to follow up on the denial of Maya stating anything having to do with mistreatment in the hospital as no, and further cross-examination as it leads up to and includes whether there are any claims by Maya Kowalski, as set forth in her records, that someone had done this, that someone had peaked, that someone had done these things. And we should be allowed, based on the proffer of Maya Kowalski, to explore the specifics of what Dr. Henschke documented in her records, and we believe either should have been or known to this witness and simply not put down or never explored. And the problem we've got here is the jury now hears from the one person out of everybody that was available to Maya at this point, because she couldn't see her mom, she didn't trust Petey. So now we've got the psychotherapist here that she's seeing regularly. And the one person that she would be more likely than not, Judge, to report something to is saying, no, she never said anything to me. And that inference drawn from that is far-reaching in these circumstances, because they've already heard Dr. Henschke testify about how Maya would open up to a female therapist. Now we've got Dr. Katzenstein putting us in a real box here, and I see no other way than to be able to explore the full circumstances of what happened with that notation she put in her records. Elsewise, I need to be able to ask, well, did she report to you about Kathy Beatty doing this, doing this, doing this? Did she tell you about another doctor? Exactly what I asked there. I'm not going to say, depending on the answer, though, I should be able to go fairly far into the specifics of the facts as testified to by Maya in order to test the witness's knowledge of these things. And that is the only way that we would be allowed to correct this wrong. This is a seminal issue in this case.
I will say that the suggestion that we start talking about the alleged sexual abuse is an invitation to do this entire trial again. Full stop.
I understand.
That has either a mistrial or a reversal written all over it. I go back to the issue of the alleged sexual abuse was not in the pleadings. It was not disclosed to the court prior to us seating the jury. We did not discuss the questions we ordinarily would have asked with respect to sexual assault with this jury. So I've got no way of knowing whether I would have had any cause challenges with any of our seated jurors or alternates as to whether or not they would still be on this jury. Now, I agree that there is an impression that the question asked that is detrimental to the plaintiff. I think the only cure that I can do at this point is the statement that Mr. Shapiro was saying is I would instruct the jury to disregard the question and answer as to whether Maya Kowalski disclosed any mistreatment in the hospital to this witness. And I'm going to have to tell the jury to disregard that. And I'm assuming, Mr. Shapiro, you're not going to follow up on that issue.
No, not on that question, Your Honor.
Your Honor, we asked...
Since I am doing a curative instruction, there's no reason for the plaintiffs to drill down that issue in front of the jury.
This is going to be tough, but we would ask the court not only to instruct the jury to instruct the jury to disregard the question and answer, but they are to draw no inferences from having heard the question and answer.
That's,
I think the instruction, the court directs the jury to disregard the question and answer as to whether Maya Kowalski disclosed any mistreatment in the hospital. I think that is sufficient. I don't think I need to go any further than that. So that's what I'm going to do. Now, we only have 5 minutes before. How much longer did you have in your?
Two. I'm
Two
sorry.
mi- two
2
questions?
minutes, Your Honor. I can finish my direct. And then
So why don't we finish the direct, and I'll send the jury to lunch. Let's go get Dr. Katzenstein. So patient with us. When I bring the jury back in, I'm going to tell them to disregard the question and answer as to whether Maya Kowalski disclosed any mistreatment in the hospital. And then we're not going to follow up on that issue in front of the jury. So we're not going to talk about it, okay? Okay. Let's bring in the jury.
All rise. Jurors enter.
Jury, I want to confirm while you're away, you did not discuss this case amongst yourselves, did no investigation, received no information. Is that all correct? And you have not been approached about this case, is that correct? And you've seen no media coverage, is that correct? Okay, members of the jury, I'm going to instruct you to disregard the question and answer you heard last, which was whether Maya Kowalski disclosed any mistreatment in the hospital. So you were to disregard that question and the answer. You may continue, Mr. Shapiro.
thank you, Your Honor. So just to recap, it sounds like the last time that you saw Maya in the hospital was for some bereavement counseling, I think on January 9th. Is that right?
Yes.
Okay. And then just to orient you, Maya was discharged shortly after that. Did you have a chance to see Maya after discharge?
It wouldn't be my practice to follow up after discharge.
Okay, and why?
Because I don't follow patients typically outpatient for therapy unless they're following up with me for a full neuropsychological evaluation, which she was not.
Okay. That's all the questions I have at this time, Your Honor, and thank you, Doctor, for your time.
Thank you.
And members of the jury, since you have been sitting there for so long, it's actually time for lunch. And I would normally say, let's go forward, but I actually have a meeting that starts in 6 minutes. So the reason that we can't proceed is because I've got a meeting. So I apologize. So we're going to pick this up, have them ready to go at 1:30. Please do not discuss this case amongst yourselves. Do not do any investigation and receive no information. And enjoy your lunch.
All rise. Jurors exiting.
Okay, the jury is out of our presence. Doctor, you're in the middle of your testimony, so you can't talk about your testimony with anyone, including the lawyers, okay? We'll be back at 1:15, unless you think we need more than 15 minutes.
No, Judge, I would, I'm sorry.
I am going to try to make some statements about the DV motion, so that's coming.
That's great.
The only other thing I would ask for the plaintiff is we do intend to play Dr. Hannah soon, if not tomorrow. I don't know if we're going to get any cross designations of his testimony, but if they don't plan to cross designate, that's why we filed our designations some time ago.
If you want to
I gotta look into that, Judge.
I'm sorry, should I just go through?
Yeah, you can, or you can keep waiting if you want. You're free to go.
Let us check on that, Judge. I would be surprised if we didn't, but.
We will be back at 1:15. You can tell Mr. Elegant and Mr. Altenburn that I'm going to try to make some rulings on DVs at that time.
Okay.
Okay, thank you very much. We'll be in recess till 1:15.